Good morning. We are sorry about that technical delay. We are now ready. Chair Sabatier, we are live, and whenever you're ready, we are.
All right. Check, check. Nope. Yeah, my mic is on. All right. We good to go? All right, let's go ahead and get started. Thank you, everybody, for your patience. Just wanted to make sure technology was going to work for us today. Today is July 27th, 2021. This is the regular Board of Supervisors meeting for the County of Lake, and we will start with a moment of silence. Does anybody have a moment of silence? Yeah. Supervisor Crandall.
Yes. So I wanted to do a moment of silence for Jeremy Hubbard. He passed away last week, and he's from Lucerne. He's a talented musician, singer for a band named Fanarin. He's an Upper Lake High School graduate, and he'll be greatly missed. He's a father, and he leaves behind some children. So I'd like to do a moment of silence for Jeremy.
Supervisor Pyska, would you please lead us in the Pledge of Allegiance? Looks like we might have some technical difficulties, so let's go ahead and... does anybody on Zoom hear me? Nobody on Zoom hears me. Can we fix the Zoom not hearing us at this moment in time? And since we are all here in the public, we're going to continue with the Pledge of Allegiance. Supervisor Simon, would you please lead us?
Take me off.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Supervisor Pyska, can you hear us in Zoom land? So I see that COLVG is muted. Usually that's unmuted. That's where our boardroom gets conveyed. There we go. Supervisor Pyska, can you hear us? All right. So sorry about that, but we missed you guys on our Pledge of Allegiance. We are moving on past to the consideration of extra items not appearing on the posted agenda. Are there any items being offered for this agenda? No? None? All right, let's move on to item number 5. Approval of the consent agenda, items 5 through 1 through 5 through 12. Any items that wish to be pulled? I believe we're pulling item 5.7 from an email that I received earlier.
Yes,
Any
Mr.
other
Chair.
items?
Yes, I have one. I'd like to pull 5.1, please.
Okay, 5.1 and 5.7. Supervisor Simon? Okay. Anything else? Seeing none, let's go ahead and open it up to the public. Any items from our consent agenda that you wish to pull for further discussion? And again, if you're in the Zoom room, go ahead and click the button at the bottom of your screen to raise your hand, or if you're calling via telephone, dial *9, and if you raise your hand, we will call on you. This is again to pull an item from the consent agenda itself. This is not public comment or public comment on specific items on the agenda. I see Randall has his hand up, and I'll get to you, sir. Let's go ahead and unmute Randall. Which item would you like us to pull for further discussion?
Can you guys hear me?
We can hear you. Which item from the consent agenda would you like to pull?
I want to discuss, I was invited to tell my story about COVID-19 and how it's affected me and our community.
Okay, well, we have that item on our agenda. It is item 6.2, I believe. Let me just scroll through. Yep, 6.2. So during 6.2, make sure and raise your hand to make that comment. Okay. So at this,
Bruno, we're unable to see the boardroom.
yes, and we are working on that at this moment in time. Let's go ahead and continue with the consent agenda at this moment in time. And again, in the boardroom, there was one gentleman who wanted to pull an item from the consent agenda, or do you have a comment on an item that is already on the agenda?
Well, I'm trying to find out if, in fact, I'm on the agenda. My name's Larry Christensen, and I talked to you a couple times that we're going to be on the agenda today, and I did not see that.
So I believe your conversation is regarding trucking of water?
No, it's regarding the ramp closures and the impact on the county.
Oh, no, those are not on this at this time, and we can go ahead, if you don't mind, we'll take a 5-minute break as soon as we're done with the consent agenda, if we don't solve the video, and I'll go ahead and talk to you directly.
The video is up now.
All right.
The video is up. If it's possible for you to hang out and we can talk during the break, or I can reach out to you via telephone. But I'm going to move on with the meeting because we're having a private conversation during the meeting, and I apologize for that. So we are pulling item 5.1 and 5.7. We're bringing it back to the board for action on the rest.
Mr. Chair, I'll move to appoint consent agenda items 5.2 to 5.6, and then 5.8 to 5.12.
Second.
Motion by Supervisor Simon and a second by Supervisor Crandall. Roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Yeah.
Mr. Chair, regarding 5.7, would you be willing to suggest a time so that staff that would be presenting that can be productive and come back later?
Let me see. There might be an opportunity between our 9:35 a.m. and 10:30 a.m. items, so maybe around 10 o'clock.
Okay, 10 o'clock is the approximate I'll give them.
And I apologize, sir, we do have at 10:30 a presentation on the current status of the drought, which is regarding that conversation as well. So I apologize for that misinformation. 5.1, let me just take a quick look. I think that'll take a little bit longer, so let's go ahead and continue with our timed items. 9:05 a.m. item, public input. If anybody has any public input on items that are not on the agenda, if they are on the agenda, let's go ahead and wait for those to come up. If you have any public input for items that are not on the agenda. And Mr. Cole, if your hand is up to speak about COVID, we will get to that next. This is again for things that are not on the agenda. If that is perfect, thank you. Anyone in the chamber have a public comment for items not on the agenda? Mr. Cole, if we can unmute Randall, please. He has his hand up, so I'm guessing that this is not related to any items on the agenda.
Randall's here, can you hear me?
Yes, we can.
Okay.
And you have
I want to
three,
give you a plate.
and you have
I want
3
you to have-
minutes.
Is it ready for me to speak?
No, at this time, we are not on the COVID-19 topic. Again, I stated
Okay.
if it's not related
Just
to an...
Let me know when.
Okay. Then we're going to close down public comment and move on to item 6.2.
Just real fast, just wanted to notify, I think it's Donna who put in a e-comment that it's in, we have it on record.
Okay.
Just so you know how sometimes they send it and they don't know if we got it or not. I just wanted to make sure she knew we got her.
Thank you for that. We did get a number of e-comments over the course of the last 24 hours. Moving on to 6.2 or 9:06 a.m. item, consideration of update on COVID-19. And today with us, we have Dr. Charlie Evans. Thank you very much for being here today. And also we have Director Pomeroy with us. The floor is yours.
Good morning, Board. Thank you so much for the opportunity to present again on COVID-19 and our current response. I'm going to turn it over to Dr. Evans for a quick note, and then to Sarah, our epidemiologist, for the epi update. And then I'll be coming back on to provide new information on testing sites and vaccination sites. So thank you, your board. It's all yours, Dr. Evans.
And you're still muted, Dr. Evans.
Hear me now?
Perfect.
Great. Thanks for inviting me to come speak to you today. This is my first role in acting as your interim health officer. And to begin, I would really like to have Sarah give her EPI update, because the information on the update really focuses and frames what I want to talk about. So if we could have Sarah present her EPI update first.
Perfect.
Good morning, everyone. Thank you, Dr. Evans. Okay. So things are changing rapidly in the state and in Lake County. On the left, we're looking at the daily test rate per 100,000. Lake County is this darker black line. You can see in the recent weeks, there's been an increase in testing in Lake County. At the same time, you see this dramatic increase in testing positivity from mid-June, down from a low of about 1% to the most recent testing positivity is 17%. This is higher than the county has experienced throughout the pandemic. You can see during the same time period, really from about mid-June, the state has had a dramatic increase, though not near that of Lake County, from about 1% to nearing 6%, the most recent time period reported here. So we're going to look at the daily case rate and the dramatic increase in new cases in a couple of ways, because I think it's really important to understand what's happening in the last couple of weeks. So on the left, first we're looking at the daily case rate per 100,000. Lake County is in this black line here. Again, you can see from your low in mid-June, about 1 per 100,000, to the most recent 7-day average is 31 cases per 100,000. Lake County has had the highest daily case rate in the state, pretty much for the month of July. You can see the state is increasing as well, and I'm going to share some of their numbers, but obviously you can see the slope of this line is increasing rapidly in Lake County. We did, unfortunately, there was a 65th COVID death within the last week, and so we are now reporting 65 total COVID deaths in Lake County, and you can see that represented here. So I really want us to look at this daily case rate to understand what's happening now and what we can expect over the next month. So here we're looking at the daily case rate of Lake County here in orange. You can see at the peak in the surge, the peak for the state and the peak for the county in the winter. For Lake County, it was just under 70 per 100,000, and then we saw the dramatic decline into the spring and had relatively really low case rates through the spring until mid-June, where we started to see that line start to creep up. And so what's different between this slide and the slide I just showed is this previous slide was a 7-day lag. Here I'm removing that 7-day lag because I want you to see that while I just reported 31 per 100,000 for Lake County, when I remove that lag, we're looking at 50 per 100,000 daily case rate in Lake County. And we are particularly concerned about the slope of this line. We are seeing increases throughout the state. And I've highlighted some of your neighboring counties, Sonoma and Mendocino in the red and the orange, and you can see that they're experiencing increases as well, but nowhere near to the extent that Lake County is. One last way of looking at it, because I think it's helpful to look at it by just raw numbers as well. This is the EPI curve that's been presented to the board and community previously. Taking you back to looking at the peak for Lake County in the beginning of the year, about 300 cases per week. Well, for the week that just ended this weekend, the week of July 18th, we have identified 250 cases. I expect we'll continue to see this number change and likely increase as more lab results are received. So again, this is just showing you again, mid-June to present. I expect we will continue to see the number of cases grow over the next couple of weeks and the next month, given the trajectory that we're on. I would not be surprised if next week we're reporting near 300 cases for this current week. So just wanted to give you some more information about recent cases. So this is cases that we opened at the health department from July 1 to July 26th. I ran this last night. That's 551 cases or people with lab confirmed COVID. 1 in 3 of these recent cases live in Lakeport, 1 in 5 live in Kelseyville, and 89 or 16% live in Clear Lake. You can see the rest of the communities listed here. Continues as it is statewide, continues to be in younger people ages 20 to 44. Half of the cases are among 20 to 44-year-olds. This has been pretty steady for us throughout the pandemic. They make up 26% of the population, but 51% of the cases. Children and adolescents are less likely to be infected, about 12% of the recent cases, and still doing a good job of protecting people 65 and older, 8% of the recent cases compared to 22% of the population. So I wanted to share the latest data on post-vaccination COVID infection. So I'm going to slowly walk through this table on the right to be really clear about what these data represent. So here we're looking as of 2 days ago, July 25th, the number of fully vaccinated Lake County residents was over 28,000 people who were fully vaccinated. At the same time, we had identified 68 cases among fully vaccinated individuals. So this is someone has been fully vaccinated, they've had their J&J or they've had their 2 doses of the other vaccines, and they've tested positive for COVID after that, they're fully vaccinated. So 68 people. So that is 0.238% of people who are fully vaccinated in Lake County have had a post-vaccination COVID infection. So said another way, on the left, 99.76% of individuals who are fully vaccinated have not tested positive for COVID in Lake County. Quickly, just want to highlight, as we've been here before, as we've seen the increase in the daily case rate, we're going to lag by a couple weeks. We're going to see an increase in hospitalizations. So here we're looking at 2 days ago, there were 10 COVID hospitalized patients in Lake County. You can see at the peak in the winter, it was a high of 12, that 14-day moving average. You can see the lag behind our daily case rate, increasing number of hospitalizations, as it has been throughout the pandemic, noting that this does not include Lake County residents who are transferred out of county. At the height of the surge, we were better able to track that, and we saw that about 50% of patients at this time were being transferred out of county. I cannot speak to the percent of people that are being transferred out right now, but know that it only includes people hospitalized in Lake County. And then you can see on the left, again, 2 days ago, the last report, 3 COVID ICU patients, and this line increasing and how it compares to the 14-day average during the winter surge. So before I go into the latest data on vaccination coverage, I wanted to highlight some things statewide. Daily case rates are going up statewide, so about 2 per 100,000 in mid-June, up to about 14 per 100,000 last week. Again, Lake County is well ahead of that with the 7-day lag, about 31 per 100,000, but looking at just the most recent time period, I'm seeing about 50 per 100,000. Which is significantly higher than any other county in the state. I think the second point is really important. The state is reporting the daily case rates between fully vaccinated individuals and unvaccinated individuals. So we're seeing a big difference between those two populations. The state's reporting about 13 per 100,000 daily case rate among unvaccinated individuals and about 2 per 100,000 among vaccinated individuals. I was looking at our data and seeing that there's about 7 times, there's people who are unvaccinated are about 7 times more likely to be infected with COVID than people who are fully vaccinated in Lake County. That's an estimate. We're looking at that data closely, but that's what I'm seeing, and that's similar to what the state is reporting. I think everyone is well aware that Delta is spreading, and in every region of the state. In June, it was about 50% of sequenced specimens. The state is reporting that it's closer to 80% now. And just a note, like we are seeing in mid-June, the state epidemiologist reported that there were about 150 hospital admissions a day for COVID patients, and early last week, she saw 2 days in a row of 500 hospital admissions a day. Okay, so briefly going to highlight the coverage in Lake County. And just wanted to share that there's been recent UK, Canada, Scotland, and US studies that looked at the second dose vaccine. If people had 2 doses of the Pfizer or Moderna, their effectiveness against the Delta variant. This is really, really great news. It's 96% effective in preventing hospitalization, which, as we've discussed all along, is one of the key goals in the response. It's 87, depending on the study, 87 or 88% effective in preventing symptomatic disease, and 79% effectiveness in preventing lab-confirmed infection. The vaccines are performing very well against protecting against hospitalization and death, and very well against protecting against severe disease. So how are we doing in terms of vaccination coverage in Lake County? 52% of people 12 and older among the eligible population are fully vaccinated. That's over 28,000 people. That's compared to 63% of Californians who are fully vaccinated. One thing that I just want to note here on this slide, if we think about the surge, the increase that's happening in Lake County right now, is there's still 41% of the eligible population that's unvaccinated, and that doesn't even include, people under the age of 12 who are not yet eligible. So when you include them, over half the Lake County population is unvaccinated. And so if you think of the tools that we have to really affect that slope of the line, they are vaccination. But if everyone tomorrow wanted to get vaccinated, who was unvaccinated, wanted to get vaccinated and got their first dose, and then 3 to 4 weeks later got their second dose, that doesn't fully take effect for 2 weeks after that. And so we really wanted to encourage to be looking at continuing to get this large percentage of the population vaccinated, but also other things that we can all do to prevent infection. That we know that works particularly among age groups, this working age, or this 18 to 49 age group, where nearly 3 in 5 people remain unvaccinated, where the majority of cases are occurring, to prevent them from getting sick, to prevent the the older population and more vulnerable people from getting sick with comorbidities. That's really critical and important right now. At the same time, to really address this surge that we're seeing right now, the things that we all know work, physical distancing, wearing masks, are really important. I'm concerned that we will continue to see dramatic increases unless we, in the short term, we certainly will. It's important to do masking and physical distancing. And vaccinating over the next month is going to be really critical in terms of preventing new infections in the late summer and early fall. I'll stop there and turn it over to Dr. Evans.
Can you hear me okay?
Yes.
Yeah. So thank you, Sarah. That was a great report. And I know we would all like to believe that we were through the COVID-19 pandemic and that it's all behind us, but unfortunately it isn't. And as Sarah pointed out with her presentation very clearly, we really have a house on fire, and it's time that we all huddle together and put that fire out. Unlike a year ago, we now have the tools to do that. We are lucky enough to live in this country where we have an abundance of vaccine that is available to all who are eligible. Next week, I'm going over to Kenya, where I started a clinic years ago, and do some work over there. Only 2% of their population is vaccinated, and it's just wreaking havoc in that countryside there. But we don't have that situation here. We have an abundance of vaccine that we can get out to people, and we have an abundance of PPE to protect ourselves when we're forced into close contact with others. And we just need to get down to it and use those tools. So I asked myself the question, why is Lake County leading the state in reinfection? And I believe it's multifactorial. It's not just one thing. Some of those factors we can control, and some of them we can't. First, I think as Sarah pointed out in her discussion, the surge really started right at the middle of June. So what happened in the middle of June? In the middle of June, we released the mandate on masking, and unvaccinated individuals were still requested to mask when indoors, but vaccinated people were not requested to continue masking. And I think the result is that most people did not mask. And so if we're 50% vaccinated, then we should see 50% of people masked. And I don't think we're seeing that. So we can't understate the value of masking when in crowded places or when indoors. Second, I think we're seeing a bigger increase because we're lesser vaccinated. So I think the numbers Sarah presented were 52% of our population is vaccinated, and of the risk group from 18 to 49, it's only 35%. So that's a little more than 1 in 3 in that group. And those are the people who are out and who are active, and those are the people who are getting infected. So thirdly, and that's contrasted to the state average of 63%. So, you're going to see a higher rate if you're less vaccinated. Thirdly, and we can't know yet how big a factor this plays, but it's the new variant in the mix, and we don't know for sure how many of our infections are the Delta variant. With time we will, but I can only guess that we're seeing a significant number of infections from the Delta variant. And I want to speak a little bit about variants because I think it's really important for everybody to understand how the variants come about, and I'm sure many of us want to know when they're going to stop. So for those who follow the news carefully, back in the height of the big surge in the winter, you remember the B117 variant, which was referred to as the Alpha variant, which was the one that came from England. And it caused havoc for Europe, leading to big surges in infection, big surges in death, because the vaccines weren't available at that time. This virus also caused a large rate of infection, a big surge in Michigan and Minnesota in this country. But oddly, we didn't see a big surge in the rest of the surrounding states. It did surge up in Canada. We don't know why it surged there and not in the rest of the states. But we didn't see the big spike in B117 that we thought we would. Again, we don't understand everything, but we do understand a lot more about this Delta variant, which is much more aggressive than the B117 variant. The B117 variant was 40 to 65% more aggressive than the mother virus, the Delta variant has 1,000 times the viral load that the mother virus has. So what that means is when you cough out a nice big cough and you spread virus particles out, there's going to be 1,000 times more virus particles with the Delta variant than with the mother virus. So another way of thinking of this is that we know this virus is airborne. So if you're indoors and say you're at the opposite end of a building where someone is smoking, but the airflow is toward you, you can smell that smoke. Now, if instead of that person smoking, that person was coughing Delta virus out, you would be also breathing in that virus. So that's the way this virus is spreading. And that's why it's so important to mask indoors. So when are the virus variants going to stop? Well, the answer to that is not until the whole world is vaccinated. And you know, the world is the petri dish for this virus. It's not just the United States, it's not just Lake County. Less than 10% of the world is currently vaccinated, leaving probably 8 billion people more to go. It's going to be a long time before all those people are vaccinated. And as long as there are unvaccinated people for the virus to find, it will continue to mutate. And you know, what the virus needs is a host that is able to accept it, and that's a host that isn't vaccinated. So I hope this makes it abundantly clear that this virus will find you if you're not vaccinated. Although you can't do much about vaccinating people in the rest of the world, China, Africa, and South America, we can do a lot about that here locally. And I think it's important for us to act locally and do all we can to decrease the mortality that this virus is going to wreak on our home communities. I want to say something about schools. I think we fully expect the schools to reopen in the fall. And if your child is of the age that they are eligible for a vaccine, I strongly encourage you to get them vaccinated. Although children rarely become critically ill with COVID-19, some do. And so it's important to do all you can to protect them. And when in school, they should wear masks until such time we have a high enough vaccination rate that the infections of COVID are curbed. So one of the areas of good news, if there is good news that we can report, is that although we're seeing another surge, the mortality in this surge is not as high as it was back in the winter. And that is because we've vaccinated a lot of the people who are most vulnerable to COVID-19 and to death from COVID-19. Those would include those over 65, and if you remember Sarah's graph there, those over 65 had a much higher vaccination rate. It includes the immunocompromised, those with diabetes, those who are overweight. So if you or your loved ones are in these categories and are not vaccinated, you are our first priority because you are the ones that are most susceptible to bad outcomes or death from COVID-19. So what can we all do about this? I know we're all fed up with masking and sheltering at home and isolating. But in Lake County, we're facing one of the biggest surges we've yet seen. If we do nothing, this situation will devolve and we will see additional unnecessary death. Last weekend, the hospitals were all at capacity. The ICU beds were full, the med-surg beds were full, all of them, both hospitals. So we're already at that point of critical overload. We know how to stop this virus, and we should practice it. Businesses should keep up their shields to protect their workers and have hand sanitizer readily available. They should have little stickers on the floor that keep people 6 feet apart. These things really make a difference. Employees and patrons of these shops should continue to mask until our infection rates drop significantly. Again, masking makes a huge difference. What we risk if we don't is further overwhelming our healthcare system, and that's going to put the mortality rates above the 0.5% and could go above the 2% because we won't have the capacity to treat them. Fortunately, right now, we do have the capacity in that we are leaning on hospitals to neighboring counties, and we transfer these sick people out. But if we keep on surging, those options will also become overwhelmed. And so it's really important that we take this very, very seriously. There is a clear path out of this pandemic, and you all know what the answer is. It's vaccination. We all need to participate in it, and if those of you who are not vaccinated, you have to rethink it because it's vital for the long-term outcome for so many people in this community. I want to talk a little bit about some of the myths around vaccination. So the Rural Association of Northern California Health Officers came up with a vaccine myths statement, and it's been circulated on social media and also in papers, but it was well done, and I thought it was worth repeating the 6 myths that they discussed there. So the first myth was, I had the virus, so I won't get it again. To the contrary, reinfection is well documented, and the COVID-19 vaccines result in much higher protection than immunity from infection itself. So even if you had COVID-19 or think you had COVID-19, you're much more likely to be protected if you get the vaccine. The second myth is getting the vaccine is worse than getting COVID-19. Plus, I'm young and healthy. Well, I've worked in the hospital since the beginning of the pandemic, and getting COVID-19 and getting sick is a bad, bad disease. People suffer, they drowned in water in their lungs, and it's a terrible, terrible thing to watch. So getting the vaccine might give you a sore arm. Occasionally there's a complication of it, but it's very, very rare. And the vaccine has a much more predictable outcome than the infection, regardless of your age. Myth number 3 is the vaccine is experimental. It was rushed into use. Well, actually, the technology used for this vaccine is decades old. It's not experimental, and we now have hundreds of millions of people who have experienced the vaccine with good outcomes. It's highly effective. We've not had vaccines that are this effective. This vaccine is more effective than polio and many of the other great vaccines that people have long trusted. And it's remarkable that we have a vaccine as effective as we do. And in this country, we have the Pfizer and Moderna, which are really the model vaccines across the world. And we're so fortunate to have access to them. Myth number 4 is the vaccine will make me sterile. Actually, they've done sperm counts on people. Those haven't been effective in the phase 3 trial of the Moderna and the Pfizer vaccines. They had 36 pregnant women that were randomized to controls and vaccine groups, and there was no difference in outcomes. This vaccine doesn't affect fertility at all. And myth number 5 is the vaccine will mess with my DNA. Someone is trying to rewrite our genetic code. Well, actually, COVID-19 vaccines can't change your DNA. All they really do is give you lasting immunity to the COVID-19 infection. And myth number 6 is we don't know the long-term consequences of these vaccines. And in fact, we do. You know, most of the side effects of the vaccines occur in the first 6 weeks. After that, there's very few. Contrary to the infection, you know, some reports say that up to 30% of those hospitalized from COVID-19 will have permanent long-term effects from the infection. That's not something we want. So I want to move back to how do we conquer this pandemic. It's a little bit about playing the odds. Here in California, we have a lottery. You know, if you play lotto, you have less than 1 in a million chance of winning. Yet many of us buy the tickets because we think that we might draw the lucky ticket and we could live more comfortably. Well, living without COVID is living comfortably. And that's where the COVID-19 data really gives us a great deal of information. We know now that if you get vaccinated, there is a 95% chance you will not get the virus. That was very clearly shown by Sarah's slide. If you're one of the unlucky 5% who do become infected, you may get sick, but very few of you will require medical attention, and still fewer will require hospitalization. So I read a statistic last week, and they vary, but there was one statistic in a county where 99% of those hospitalized were not vaccinated. Only 1% were. To me, these are the odds I want for myself, for my family, for my loved ones, for my community. And I strongly urge you all to get vaccinated. The Delta virus is on the rise, and it has been found in Lake County, and my guess is it plays a significant role in our surge. It may be what's fueling it, and the vaccine will protect you against this variant. We know that. By becoming vaccinated, you do not only help yourself, but you also are protecting your children who are too young to get vaccinated, and you're protecting those who are immunocompromised. Because immunocompromised people, even if they are vaccinated, can get quite ill. All the data and all the science of these vaccines show that they're safe and they're effective, and they protect us from the severe consequence of COVID-19. And those graphs that we just saw show there's no time to waste. If we all get vaccinated tomorrow, we're still going to see a big surge next week. COVID-19 is looking for hosts who are not yet vaccinated. And I'm sure if you're not vaccinated, it will find you. So I strongly encourage you all to act promptly. And with that, I'm going to give it back to you, Mr. Chairman.
Thank you very much, Dr. Evans. Appreciate all the data and information provided as well. Any comments or questions from board members?
I have a couple comments and questions.
Go for it.
Thank you, Dr. Evans. I really appreciate this presentation today and really putting all the data into context with what we're dealing with locally in our county. I just want to point out that I've heard the Facebook feed for this section of the meeting is not live. And if we could just clip this COVID update and get it up for people to watch later, I think that's necessary for everybody to see, as well as the Sarah's slides, so we can just get this information out to as many people as we can. I'm wondering, so it looks like the vaccination rate for the 12 to 17-year-olds is 19%. Is that correct?
Sir, I'm going to defer to you on that.
Yeah, let me take a closer look. I think it's about 20%. Yeah, so 81% of people 12 to 17 are unvaccinated.
And we have school starting in roughly 3 weeks. So it's really important for families to consider right away getting their children that are eligible for vaccines, to get that done right now. Before school starts, you know, they're still going to be not fully vaccinated after school begins, but it is time to make that push right now. Have we seen an increase in vaccination rates in the past week?
We're seeing it's very slow. For the last 2 months, month and a half, we see about a 1%. You know, last week I reported 51%. This week I'm reporting 52%. It's very slow.
Okay, so hopefully next week we'll see a bigger jump, hopefully. And one other issue that's kind of coming up is we have some large events that are planned. And people are looking for guidance on whether or not to continue with these events. Some are outdoors, some are indoors, but with the rate of spread that we're experiencing, Dr. Evans, can you give some guidance on how these events should be carried out or potentially canceled?
Yeah, so that's a great question. And, you know, at this time with such a high rate of infection, I would strongly discourage any indoor large functions. You know, outdoor is much safer where there's good ventilation. And some studies suggest that, you know, if you socially distance and you're outdoors, you're fine. So I would certainly move to postpone those that are indoors. but those that are outdoors, I think particularly if people are careful and they mask, you're much better off.
And, okay, so that's good information if it's outdoors. So if you're in an outdoor event that's very crowded, your suggestion would be that people should mask and distance?
Yeah. We all saw those graphs. We're right back to where we were last winter. And, last winter we were masking and being extremely careful. And that's unfortunately what we have to do right now when we're at this high risk setting. There's so much COVID in the community that people have to take every precaution they can to protect themselves, even if you're vaccinated.
Right. Well, thank you so much. I really appreciate it. Those are my questions.
Thank you.
Thank you, Supervisor. So I will just make a quick statement that I am fully vaccinated, probably got vaccinated about, 3 to 4 months ago. I did it for what I believed was for my best interest, the best interest for me, for my family, and for my community. I would urge you not directly to go get vaccinated, but go talk to your primary provider about vaccination. I'm not going to know what your background or your medical history is. Your medical provider will. Have those conversations. Don't just decide what Google or anyone else. Have those private conversations with your medical provider. They will know and understand what your needs are and understand what is happening in our community as well and be able to provide the best guidance. So I would say please make sure and have those conversations with your medical provider so you can make those decisions with better information or the best information. If there's nothing further from supervisors, Supervisor Simon.
Yeah, just want to thank you for the presentation today, both Sarah, Dr. Evans, and obviously Denise, and continuing this thing. As far as our updates that we're giving here at the board, at this point, you're either on one side or the other of the vaccination conversation. And so what we're doing is continuing our information so we can educate and try and get the information out there, just as Supervisor Sabatier said, Chair Sabatier, so you can make your decisions, how to protect yourself, your family, and make those decisions. I myself too, and I said it last week, was vaccinated with the Moderna vaccine, and will continue to encourage that with my loved ones, my family members, and folks surrounding myself, and also our employees that we're responsible for. There is an opportunity there, but it is your own decision, and so we'll continue on that path. The ultimate goal that we all know is to continue to have our businesses open and to function in the best way that we can so we can work through this pandemic, and we'll continue doing that. There are, like I said, passionate folks on both sides of this. You make your own decisions for your families, but we're going to continue to provide the information and to be educated as we move through this process. So I myself, I said it last week too, I am not a doctor. We'll look to gather the information and to make those decisions. But as folks said, well, what are you doing? Well, I made the decision and I felt like taking the vaccine was the right thing to do, and I've done that. So as we say, and I said it last week, you'll see as we move through this process how it affects folks. So not only asking folks to do what they need to do, but also did it. So I would not ask someone to do something that I would not be willing to do or put myself or my family in that place. And so we'll continue with this messaging. So I want to thank everybody from the Public Health Department, all of our hospitals, as we've heard. There were quite a few folks that are in the hospital. I wish everybody good luck and, good health to get out of the hospitals. And not only do I employ all of our employees here at the county we're talking about protecting, but also have business and a tribe that we're protecting on my behalf. And we'll continue to give that message of please take an opportunity to get that vaccine. The worst thing we want to hear is losing a family member just over some information that may or may not have been correct, but please have those conversations, as Chair said again, with your health provider, and hopefully move in the right direction. But other than that, if you're not going to, please wear a mask. It is inconvenient, but it could save your life, other lives, and that's all that we're asking. So thank you.
Thank you for those words. Any further comments I do have Director Pomeroy. I missed that her hand was up, and so before we open it up for the public, Director Pomeroy, the floor is yours.
Thank you, Chair Sabatier, and thank you, Dr. Evans, for your update, and Sarah for all of your work on your epidemiology. I just want to give a few updates to the board on testing and vaccination. Dr. Evans has written a letter that will be going out to all of our medical providers today, asking them to up their efforts in both testing and vaccination. In prior months when we were at our height, a lot of the clinics were doing additional clinics, so we're seeking that partnership again with them. The Public Health Department just finished doing all the schools, or having testing and vaccination at, not testing, vaccination at all the schools. We will continue to work with the schools as it gets closer to get more vaccinations done. Starting this week, starting tomorrow, Public Health will be doing vaccination and testing at our health department. So tomorrow, Wednesday, from 8:30 to 11:30, will be testing. And Thursday, from 8:30 to 11:30, will be vaccination opportunities. And then starting next week, which we will do a press release later this week to give the actual times and stuff, we'll be doing testing on Tuesdays and Wednesdays and vaccination on Mondays and Thursdays. That'll be at the Lake County Bevins building. I do have our director of nursing on. She could probably give more information on the details. This was just set up in the last 2 days, so we are working really diligently back at our, pulling some of our plans out that we did earlier in the year to get these sites up and running quickly. In addition to that, we still have the Optum Serve site down in Lower Lake. They do testing on Monday and Thursday, and they do vaccination on Tuesday, Wednesday, and Friday. So that is 18 and older. They are currently not giving out Pfizer, and Pfizer is the vaccination for the 12 to 18 years of age. We will be offering that here at our health department. Our message to the public is exactly what Chair Sabatier was saying, and Dr. Evans, please see your provider. If you think you are sick, call them. Let's try to stay out of the EDs. Your providers can handle this. They have the vaccinations, they have access to the testing. Please seek out their medical input for your own health. With that, the additional sites are still up, so you can get vaccinated at the majority of the pharmacies in Lake County, your providers, the health department, Optum Serve. So please take care of yourself and your family and your loved ones. That's it. Thank you.
Thank you very much. And I know you offered for Carolyn Holiday to speak, but because our time is overlapping many of our other items, if it's possible to put that information out in a press release or social media, that way the information is readily available. It's not easy to take notes as we're speaking right now here in the meeting. But for time's sake, we're going to open it up to the public and get started there. I have one hand in, and I'll get to the boardroom in a second, phone 4627. Let's go ahead and start in the Zoom room.
Good morning, this is Tom. Can you hear me?
We can hear you.
Tom Slade here. I had a comment and then some questions. These cases that we keep hearing about, to my knowledge, are based on the PCR test that has been, to my knowledge, discredited by the World Health Organization as being meaningless for diagnosing COVID cases. And I sent an email that Jessica probably got this morning, and there's much, much more than that. But she can take a look at that. And it seems to me it brings this whole report into question because it's all about cases. And one of the commenters spoke, moving on, things that work. And I've been looking into this. I don't need to be a doctor to read and think and ask questions. And as far as I can tell, there are possibly treatments and preventatives for COVID, HCQ, ivermectin, zinc, vitamin D, especially in combinations. Now, it's controversial, but there's a lot of doctors saying that they are using it and that it works. And it can, possibly eliminate the need for hospitalization and save lives. I don't know, but I would ask, from the health department, what is their comment? What are their thoughts about that?
Thank you for your comments, and we're gonna go ahead and take all the comments and write down questions, and then we'll go ahead and answer them all at once. That way we can just make sure that we get to everybody in time. So those comments and questions have not been lost or ignored. We will get back to you on that. Let's go ahead and open it up for Will Tuttle.
Yes, okay, this is Dr. Will Tuttle. I'm, again, publicly questioning the official narrative about COVID as it's being rolled out here in Lake County, because it's a direct attack on our constitutional rights and freedoms as well as on our health on every level. I'm also speaking on behalf of thousands of people here in Lake County who feel the same way I do about this, but don't speak up at these board meetings because they believe, perhaps rightly, that it's futile to do so. I was born and raised in Concord, Massachusetts, the birthplace of the American Revolution against British tyranny, and I was raised to honor the memory of the townspeople who in 1775 gave their lives in the first battle of the Revolutionary War at the Old North Bridge in Concord. And with their blood and their courageous example, they helped to lay the foundation for our Constitution, guaranteeing our rights and freedoms, and that the government is only by the consent of the governed. And yet, in less than a year, we have seen these precious freedoms and rights seriously eroded by the fraudulent narrative of a medical emergency, forcing people to shut down their businesses, wear masks, distance from each other, and leading to sharp increases in suicide, alcoholism, drug addiction, and spousal and child abuse. The big news lately is that just a few days ago, on July 21st, completely ignored and buried by the mainstream media, and not discussed here at all today in this meeting, the CDC announced that it is directing all COVID testing labs in the United States to phase out the PCR test, which has been until now the gold standard used to diagnose people with COVID. No reason is given by the CDC, but perhaps it's due to the huge number of lawsuits which will reveal what many honest and heavily censored health experts have been saying from the beginning, which is that it's a completely bogus test for diagnosing any disease, especially COVID. This means that the case numbers you've been hearing that have driven the mandates and the vaccines, everything, are all based on completely fraudulent foundations.
Can you please pause for a second?
800,000
Mr. Tuttle?
It's a fraud based on the
Tuttle?
PCR test and the CDC's new
Mr.
access.
Tuttle, I'm not trying to interrupt you, but we can't hear
Mask
you.
wearing. There's never been any double-blind controlled studies showing that mask wearing is effective. In fact, in a recent published review of 17 main studies that have been done on mask wearing, the conclusion was, quote, none of the studies established a conclusive relationship between mask use and protection against viral infection. There are many damaging effects of mask wearing, including harmful hypoxia or low blood oxygen levels, hyperpenia or high carbon dioxide levels, as well as nose, throat, mouth, and lung infections, and many other harmful effects, including psychological disconnectedness from others. So, in closing, I want to say that I feel that we should emulate the American Indians who taught that we should live close to the earth, that we should breathe and savor the air, we should rejoice in the beauty and kinship of nature and animals, we should open ourselves to the healing power of the sun and the sky, we should treat each other with respect and kindness, and we should question all the directives coming from the exploitive government power centers in Washington, D.C. and Sacramento, which the Indians learned from bitter experience were deceitful, deceptive,
3 minutes are up,
harmful.
Mr. Tuttle.
All this fear is toxic and completely unfounded. Thank you.
Thank you very much. Next, we have phone 6478.
Hello. Can you hear me?
Yes, we can.
Yeah, my name is Madeline, and I think it was very good what somebody said in your crowd, that we have to look at it and not to be right away vaccinated, because we should see both sides. And I think it's missing. We hear your side, I mean the side of precious vaccination and mask wearing, distancing and all that for a whole long time. But there is nobody there who talks from the other side why not to be vaccinated, why the masks don't work, and all these things. So how can we make a wise decision? I'd like to ask you this question and be answered, and have somebody there who also speaks about the other side at length, and not just 3 minutes. That's not long enough. Some people of us are very, very knowledgeable, and they know a lot about why not to vaccinate, why masks don't work, and they don't have enough time. And you have so much time to explain why to be vaccinated, and kind of with a little power in behind to push it on us. So I ask you this question. We like to have somebody represented there who can talk at length about why all these things don't work and why it's untruth what we hear. Thank you.
Thank you. I see no further hands up on the attendees. I am going to call on Randall, who tried to make a comment multiple times. This is your item that you wanted to speak on. If you don't raise your hand, I'm going to move on to the boardroom. I believe you were unmuted 2 seconds ago. There you go.
Can you hear me?
Yes, you have 3 minutes.
Okay, thank you. I want to take the opportunity to address Lake County Board members. Thank you for this opportunity. I also want to give you a set of facts. I'm only dealing with facts from the other side of death. And I've been gracious enough to come home. And I'm sitting here and I come home with information. I want to give you a play-by-play of what happened. On July 7th, a friend of mine got his second COVID test. I had connection with him on July 8th. And when I saw him, I said, "Are you okay?" He said, "Randall, I got my second test and I'm not feeling well." He had a fever blister on his mouth. And see, I had let my guard down because they said for people that were fully vaccinated didn't have to wear a mask. And so I was not vaccinated. I was very anti-vaccination. And so with that said, when I saw him on the 7th, on the 9th, 24 hours later, I was hit with COVID-19. We did tracing. I've been working with public health. We traced it down. That was the only guy I had contact with. And he had his second shot, and he was unmasked and was able to shoot the droplets, and I took him in. And I wound up in ICU on 7/10, and I was there for 14 days. I'm at home, and I just want to tell you, people have free will. They can choose whether they want to be vaccinated or not. But our county, our responsibility is to protect our community. We need mandatory masks, whether you're vaccinated or not. If you don't want to wear a mask, stay at home. My wife went to Walmart yesterday and Rite Aid, and she was the only person in both stores who have a mask on. If you're going to do business in Lake County, Walmart, Rite Aid, and all these people, they have to protect our community. They have to protect our people. They have to, no service if you don't have a mask. We will still get the revenues. People will mask up, they will still go to the store and buy the products, we will get the revenues. We did it with seatbelts. Seatbelts save lives.
Your 3 minutes are up.
Masking will save lives. Thank you very much for my opportunity to share that with you.
Thank you for the comment. Next is Savannah.
I just wanted to say a big thank you to the Board of Supervisors and to Public Health. Just thank you so much for the transparency. I know everybody's working really hard. I know this is a difficult situation. I myself am in education, and it's been a really difficult road managing COVID and managing how to keep our students safe and how to keep our staff safe So we just really want to say a big thank you to you guys for all the hard work you're doing and all of the effort that you're putting into to keep the community safe.
Thank you for your comment. Next is Leonardo Rodriguez.
Hello?
We can hear you.
Okay, awesome. Hello, my name is Leonardo David Rodriguez. I'm the student trustee at Mendocino Community College, and I just wanted to comment on education and what COVID has really done to education. It has completely thrown off so many students, and, you know, we thought vaccination would help us with that. But, you know, in a county that's only 50% vaccinated and a Delta surge, it doesn't look like schools should start reopening again. Especially when this variant looks like it affects younger people even more. And as someone who was enjoying their college experience, to have it taken away after so much work was really hard, but we adapted to it. And, you know, we've been dealing with it. And I would just ask of people that, you know, don't plan on getting vaccinated to think of not only of themselves, but of their community and their families, their future. And to think of students like me who are trying to get a higher education and can't even go to their colleges, of which some people are paying, you know, thousands of dollars to attend. So I just urge people to get vaccinated, to do their part. Thank you.
Thank you for your comment, and that's the last hand in the Zoom room. I saw a couple hands here. Let's go ahead and come up to the microphone. I'm not going to call on people. Please just come to the microphone. And the only reason I call people in the Zoom room is because their names are actually printed right in front of my face. I don't want to get your names wrong.
Thank you for your consideration. It's very much appreciated, all your remarks. And to the scientists, Dr. Evans and Sarah, I have been familiarized with a lot of that information, and a lot of it is bought by the industries, Pfizer, Moderna, and manipulated data. To that effect, I would like to say that 12 American healthcare professionals, among a growing many more, have had their careers and lives threatened, social media platforms censored and deleted, and been labeled by the CEO of the United States Incorporated as disinformation dozen, all after sharing the truth and evidences that they've come across in their work that have conflicted with and exposed the media-driven fear pandemic organized by the companies whose science you say you trust. The CDC is a vaccine company whose guidelines have been blindly trusted as sound science, destroying livelihoods and cognitive and social development and basic rights and freedoms around the world until now. This was all based on inflated case counts as a result of the RT-PCR test designed using gene sequences of the 2003 SARS coronavirus, because to this date there is still no SARS-CoV-2 viral material available, only synthetic nucleic designs thereof. The WHO tacitly admitted this January that all tests conducted at or above 35 cycle thresholds are invalid. Why would I come across the county with this information I've gleaned with data, science, studies, and statistics up to my eyeballs that I've poured over for the last 16 months when I don't have children or feel any pressure to partake in any gene modification experiment or cover my airways for anyone, and don't ask that of anyone I know or anyone I don't know? 30 years I have loved and lived science. Today, I love and live in truth. Maybe the genocides I descend from are smaller in numbers than that from which you hail. Does that negate the wisdom and trauma I inherit with it and its indication that with censorship comes medical fraud, malpractice, and tyranny? Maybe it's trite to you that I've faced censorship for sharing information about the Tuskegee experiment, or that I've used my adult privilege to grow organic produce for my community in exchange for WIC certificates, or often less, all to find myself without land for the last 2 years. What's trite to me is faith in false scientists funded by the same organizations who passed out the smallpox bioweapons on blankets, claiming that they were trying to help. What a privilege it must be to make policy on 16 months of 97% false positives from a Class 1 recall test that failed full FDA review and had its emergency use authorization revoked. I ask you, in standing with the Chilcotin Nation of the Universal Supreme Court, the Lenni, the Napi, the Lakota, the Blackfoot, the Pomo, the Paiute, the Huape, the Suwannee, the Cherokee, the Algonquin, the Taino, and all the children of Turtle Island and far beyond, is human civilization really on the path of progress? Or is human society being further degraded with each passing day? Thank you.
Thank you for your comment. Next hand.
I'm sorry to interrupt, but can I get people's names?
Oh, we didn't get your name. If we can please get your name. Thank you for reminding me, Joanna.
Thank you. Ahava Rose from Middletown.
Thank you. Next. Go for it. Go for it. She's just taking a stroll.
My name is Joan Moss. I speak out quite often. I wanted to let you know that Dr. Evans' voice was clear. The lady who just spoke was going so fast, I could not hear her. And the woman who spoke up for Lake County, I could hear her half the time. I'm getting a hearing aid soon. Things might change. I'm wondering if the report, the official report, is in print anywhere, so those of us who might be a little hard of hearing can understand every word. This time the words were bigger and I could see them. It was improving. But I think the sound production of the woman from Lake County needs to be as good as the sound production from Dr. Evans. Thank you. Then we can hear what you're saying.
Thank you very much. And I believe that this video will be replayable in the near future. And also, if you need further data, just go ahead and contact me and I'll make sure you get that data. Anybody else in the boardroom have a comment on this item? Okay.
Mr. Chair?
Yes, please.
I did just want to make a comment. I think that we also have hearing devices, correct, that are available to attendees here, so.
Thank you for reminding me, yeah.
I just wanted to say that there is an opportunity before the meeting, so there are hearing devices. If you're having trouble, please let us know, and the administrative office will help you with that, so. And I see Sam holding something up in the back there, so. Okay.
Thank you. Your microphone is not on.
Well, I was going to say the volume is the same when it's projected in the room, but people's pitches vary.
Yeah.
So.
And unfortunately with Zoom, different equipment does different things. One of our speakers, there was a lot of rubbing on the microphone or some kind of other noises in front, so we can't control everything that happens with so much equipment being used. But we seem to be done with public comment, so I am going to bring it back to the board. Before I ask Dr. Evans to make any response to some of the medical stuff that was stated, I do want to make some corrections. I did look up some of our death reports from last year. Suicides are down in Lake County, not up. Do they still happen? Yes, and if they're personal, they are absolutely debilitating to friends, families, and anyone connected. But there is not an increase in suicide, nor at one point, we heard from our sheriff that there was not an increase in domestic violence either. I'm not sure what that overall number looks like for the full year in comparison, but we were getting information. So what you read in the national news does not always equate to this is what's happening in our local communities. And so we need to make sure to not use the Simpson paradox of looking at the aggregate and thinking that it's happening exactly the same here in our own little county, where we have different numbers and different reactions and different ways of living and a unique culture as well. And I'll just stop there. I will not make any slight comments so as to not distract from the real conversation. Dr. Evans, there was some medical questions, something about the PCR test and also the availability of medicine. I'd rather you take a look at that and respond versus my response to that.
Thank you. Can you hear me?
Yes, we can hear you.
So first, Tom mentioned that the PCR test had been discredited. So, I have to differ with you, Tom, on that. I'm an ER physician and have been for 37 years. We use PCR tests in many different modalities, and it's an extremely sensitive test. It tests the DNA of the virus. And the only time it falters is when the test is not administered correctly. But it has been a life-saving test that has allowed us to detect the COVID-19 virus on numerous individuals and know whether to hospitalize them, know whether to treat them as outpatients. It's been a life-saving test. And you were correct that there are other treatments that people can do to prevent getting COVID-19. And you mentioned vitamin D, zinc, vitamin C, and all these have been looked on favorably. There have been studies done on them. You know, I am one that's not a big proponent of promoting drug companies and vaccine companies for the business, but for the science. And taking vitamin D, taking zinc, taking vitamin C is certainly not harmful and may be helpful. And in fact, I will admit that during the heart of the pandemic, I took vitamin D, zinc, and vitamin C when I was seeing COVID patients every day. And I was lucky enough, probably because I was wearing my mask 100% of the time, not to become infected, despite treating hundreds of COVID patients. So with regard to Mr. Tuttle's comment about the mask wearing is not protective, to the contrary, there are numerous controlled studies looking at masks, and it varies according to the type of mask too. So, you know, wearing a bandana is not as protective as wearing a surgical mask. Wearing a surgical mask is not as protective as wearing an N95. Masks work. And the stronger the mask, the more protection you get. And I highly encourage people to continue wearing masks. I did agree with you about your Native American comment, living closer to the earth and savoring the air. You know, every time we can do that, good for us, because that's what life is living. Randall, I'm really sorry that you became infected. I have seen your story so many times, and I really applaud you for speaking up for the mask. And I think that if more people were to wear masks, you're right, we would not see the surges in infection that we're seeing. Madeline, you said let's not rush into this with regard to vaccinating. You know, we're over a year into this pandemic, and we've had vaccines for about 9 months. I had a patient last week who came in. She was in respiratory failure. Her lungs were a whiteout on the chest X-ray, and as I was getting her ready to go to the ICU, she asked me if she could be vaccinated. You know, I told her, you know, it's too late for you to be vaccinated, you're infected. And I think it's really important that we're not rushing into anything here with the vaccines. We have nearly 1 billion people vaccinated. This isn't about making the vaccine companies wealthy. This is about protecting you. If you go to any ICU in this state, you're going to see COVID patients on ventilators. Many of you have experienced death in your family, and the numbers are huge, but when it's somebody in your family, it's horrible. It's just horrible. I lost a family member to COVID. Leonardo, I really sympathize with you and what you're going through with trying to educate yourself, and I completely agree that wearing masks is the way out of this. And I certainly hope that we can get people vaccinated and get schools to be safe. That is our goal. And those are the notes that I took. The woman who spoke fast, and I didn't get her name, she was talking about vaccine companies doing things that were more in the interest of their company. You know, vaccine companies makes vaccines, and you know, they're for-profit companies, but I can't tell you how fortunate we are in this country to have this kind of technology widely available to us. As I mentioned, I'm going over to Kenya next week to work in a clinic that I helped start 30 years ago. They have nobody vaccinated in that clinic, and they barely have oxygen. You know, we need to take advantage of what we have here, and we should be proud that we have that technology to offer to our people. So my message is vaccinate and wear your mask. Wash your hands and wear your mask. Thank you.
Thank you very much, Dr. Evans. The last thing that I will say is just two simple things. One, some gentlemen spoke about the American Revolution leading to Constitution and the creation of our country. Please do a little bit more search on the American Revolution. Without mass inoculation by George Washington on the Army, there would not be a win for America in the Revolution. Make sure to look into that so you can better understand why inoculation is useful. And then also representation of the other side. It's hard when the other side is not in science to have them represented. And I will go ahead and go with my unfortunate remark. It'd be like asking our diversity group to have a position for a bigot. I just don't think that that would make for a very good conversation. We want to move forward, not be stagnated in where we are moving. And if there's any further comments from the board, then thank you very much, Dr. Evans. Thank you, Sarah, Director Pomeroy. Thank you for your update. And because of our status, I'm sure that we will have these updates a little bit more often than we've had in the last few months. And so we will see you soon.
Thank you.
I apologize for the time that we have taken on all of this, but these discussions need to be had. So let's see if we can try and move quickly through some of these. Our 6.3 item, 9:30 a.m. item, presentation of proclamation recognizing Lake County AmeriCorps Civic Spark Fellows. And Supervisor Pyska.
Thank you. I'm going to read the proclamation commending Lake County AmeriCorps Civic Spark Fellows. Whereas Civic Spark is the Governor's Initiative AmeriCorps program of local government commission in partnership with the state of California through the Office of Planning and Research and California Volunteers. And whereas Civic Spark is dedicated to building capacity for local governments to address emerging environmental and social equity resilience challenges such as climate change, water resource management, affordable housing, and mobility. And whereas each year Civic Spark recruits fellows to build local public agency capacity throughout the state for an 11-month service year. And whereas during their service, Civic Spark fellows implement a needed sustainability and resilience project while building long-term capacity to ensure the work is sustained after their service year is completed. And whereas Civic Spark has had a presence in Lake County communities since 2017, with a total of 13 Civic Spark fellows who have served the Lake County community, dedicating over 170,000 hours of service and the community. And whereas Lake County Civic Spark Fellows have implemented many projects in the community, including automatic metering implementation, storm flow 2017, conservation and hazard mitigation plan, and water conservation through AMI and GIS in Hidden Valley Lake, storm flow assessment, locating and identifying utility assets and GIS mapping, and storm flow analysis and capacity assessment in the city of Lakeport, GIS-based fire resiliency prioritization plan for Lake County through the Clear Lake Environmental Research Center, and the ARC-GIS-based asset management system development, and the Clear Lake shoreline assessment and inventory with the County of Lake. And whereas Civic Spark Fellows are also tasked with planning and implementing volunteer engagement projects in their community, and Lake County Civic Spark Fellows have dedicated over 1,300 additional hours developing and implementing volunteer engagement events throughout the Lake County community. Now, therefore, be it proclaimed, the Lake County AmeriCorps Civic Spark Fellows are hereby commended for their dedicated service to the people of Lake County, and we extend to our previous, current, and future fellows happiness and great success in the years ahead. Issued on this 27th day of July 2021. So I just want to really show my appreciation for the Civic Spark Fellows that we have. that have come before this year and have worked through this year. And I'm hoping that we have Deputy Director Delijanis on here to read the names of our 2020 and 2021 fellows.
Hello, can everyone hear me okay?
Yes.
Awesome. Thank you. Thank you to Supervisor Paiska for reaching out. It's an honor to be here to recognize our current fellows. As Supervisor Paiska has said, we've had 13 AmeriCorps Civic Spark Fellows, and we've actually had a few of them remain in the county, 2 from previous years, including myself, and then also 1 from this current cohort who will be remaining in Lake County to continue to serve our community. So the 2021 current fellows are Nicole D'Amato and Liam Healy here with the Lake County Water Resources Department. We also have Miles Johnson here with Lake County Special Districts, Connie Reethen with the City of Lakeport, and then Laurel Beard, who we will be hearing from in a moment with the Clear Lake Environmental Research Center. So thank you again, Supervisor Paiska, for recognizing the fellows. As we mentioned, we have been able to be honored and had the privilege of working alongside these fellows to help us build capacity in a numerous of projects as outlined here. So thank you today. And I would like to welcome Nicole and Liam, who are here in person today, to accept this proclamation.
Mr. Chair, should we revise our time estimate for taking up item 5.7? There's a member of the public and also staff.
You and I were on the same page, absolutely. We are so far behind right now on our current agenda that I was trying to figure out where it is that we would be able to fit it in. I think that the next few items don't have much room to be able to find a space for that item. So I am going to I think I'm going to have to kick it to 2 p.m. This afternoon after our lunch, just to be fair, so that we don't ask people to wait around a little further. Again, this was on the consent agenda. We do want to make sure to have that conversation before going through the consideration process. But at the same time, I want to be respectful to the times of those timed items before us. So I would say 2 p.m. this afternoon.
Okay.
And I apologize to those that it impacts. But we will have that conversation, and if you can't make it back here, it's possible for you to join us on Zoom to make sure that you are a part of that conversation as well. Director De Leon, I'm so sorry.
That's okay. Good morning, Mr. Chair. Good morning, Board. I just wanted to take a minute to publicly recognize Nicole and Liam for outstanding work this year. You've heard me say before, I challenged them with producing something that was tangible and was something that we could continue to use moving forward, and they accomplished that and exceeded my expectations. And this is indicative of our young people today. We're in pretty good shape. These two are amazing young folks, and they have very bright futures ahead of them. And I just, again, would like to publicly thank them for the work they did for us this year.
Absolutely, absolutely. Your presentation on the shoreline assessment, your help with the Middle Creek Restoration Project and the mapping that has been done, I really appreciate your help. What people need to recognize is this helps supplement all the work that we're already doing. It doesn't supplant it. This is to help us move even further and faster and more efficiently towards our greater goals. And thank you so much for calling Lake County home for a little while, and when you are done, to have a safe trip home. So thank you so much for your time here. Anything further before we move on? All right, let's go ahead and move on to our 6.3 a.m. item presentation. Oh, no, sorry, 6.4 item, 9:35 a.m. Civic Spark presentation on fire mapping, and Supervisor Pyska.
So I had the pleasure of working with Laurel Bard this year through clerk, and she did an absolutely incredible job with her fire mapping, and I wanted the public to have a chance to see how seriously we take our fire mitigation efforts these days. And this is a great opportunity for Laurel to make the presentation. I'm also delighted to share that Laurel's going to be continuing her work in Lake County with clerk. She's going to be starting that after she takes a little break after all this work. So I want to pass it over to Laurel, and I think you're going to be pretty impressed with the amount of work that she's done and really moving us forward into the next place that we need to be with fire mitigation and hazardous vegetation management.
Thanks, Jessica. I'm really excited to present, and it's been great working here in Lake County for the past year, and I'm excited to continue with Clear Lake Environmental Research Center in the future. My presentation should only take about 15 minutes, so even though there's an hour blocked out, hopefully some of that time can go to getting us back on track time-wise. So I'm going to share my screen. Let me see. Here we go. Can you all see? Great. All right, so this is a presentation that showcases the work that I've done over this past year, organizing the community and sharing data and organizing data about fire management so we can tackle wildfire risk in the future. This first part is a bit of a history of Lake County's fires. A lot of you already know this. This was made for the general public, so Lake County residents at this point are experts on it, but I'm going to go over it anyway. So in the 100 years before 2010, there were 211 recorded wildfires in total in Lake County. Despite this, the wildfires were not as intense and not as all-consuming a concern for Lake County residents. However, this changed between 2010 and 2020. So again, in the 100 years prior to 2009, Lake County experienced consistent small to medium-sized fires. On average, 24 fires occurred per decade, and average fire size was about 3,000 acres. And here you can see the old fire footprints over the past 100 years before 2009 in Lake County in gray. Now we're starting to see fire footprints that start in 2010. They look pretty similar to the ones in the past 100 years, but that's going to change. So the 2010s were the hottest decade in recorded world history and one of the driest in California's history. 2011 to 2014 were California's driest years on record. Here you can see the footprint of the Valley Fire, which happened in 2015. And you all know the Valley Fire very well. It had a big impact on day-to-day life for Lake County residents. And this scrolls ahead to 2018 to show the Mendocino complex fire, which became the largest wildfire ever recorded in California, burning a large swath of the Mendocino National Forest. And now we're caught up to 2020. This fire history is current to 2020. Sadly, I'm sure this is going to change this year. But in total, 63 wildfires occurred between 2010 and 2019. Average fire size was about 25,000 acres, which was more than 8 times the average for the 100 years that had come before. In addition, the previous decadal average for the past century was 24 wildfires per decade. Obviously, 63 is about 2.5 times more wildfires than on average occurred in the decades from 1900 to 2009. And in 2020, the August complex here surpassed the Mendocino complex as the largest wildfire ever recorded in California. Over 65% of Lake County's land area has burned in the last 10 years. And as you all know, wildfire is a very serious problem for Lake County. So in 2009, the Lake County government, along with the Lake County sorry. Yes, the Lake County Resource Conservation District, which is affiliated with both the county and the state, took steps to create a community wildfire protection plan in 2009. But because of some issues with the document and obviously because of the immediate emergency severity of the wildfire situation, the document remained largely unused for the next 10 years. In 2020, it was obviously necessary to update the protection plan because the county and many community groups felt that it was a necessary document to organize and forward fire management in Lake County. So there were a lot of projects in the Community Wildfire Protection Plan. And that was a strength because it identifies a lot of places where we need to work, but it was also a weakness because there were so many high priority projects that it was hard to know where to start. The 2009 CWPP prioritized projects on a scale from 1 to 3, and over half of the listed projects were listed as highest priority. It wasn't clear how these projects had been prioritized, and as of early 2020, there was no record on what work had been done in the year since 2009, and some of the projects were in areas that had already burned. So in my project, I was tasked with organizing the GIS data and creating new GIS data for the Community Wildfire Protection Plan so that we can all see the highest priority areas in the county and create an action plan that actually goes step by step to address these problem areas. The CWPP, over the time of my service, was transformed into a living document. Action items were visualized, new items were added through community input. I'm not sure if any of you attend municipal advisory council meetings, but I attended a few of those to talk to the community, to explain what I was doing, and to hear their feedback, because community members are some of the experts in this county about high priority areas for fire risk. So information like fire and management history was updated for each item in the CWPP, and items were prioritized based on a number of relevant factors. So here's an example of the 2018 Pawnee Fire, which burned at high intensity through the Wolf Creek Watershed. In 2009, the area was designated as the highest priority in the CWPP. The Pawnee Fire did reduce fuel load in the hills, which changed the area to moderate high priority instead. Relevant prioritization factors were proximity to communities, proximity to evacuation routes, fire and management history, fire threat as determined by CAL FIRE, and field ratings by myself. Priority was determined by assigning a numeric weight to each relevant factor and adding the numeric weights together using a program in Python. The final numbers were each connected to a certain priority level. Here's a picture of the code that I used to prioritize this. I'm not going to go over it right now, but this is what it looks like. So this is a visual aid to see how this has helped really focus the highest priorities in the Community Wildfire Protection Plan. So these are the former highest priorities that were established in 2009. And if I scroll over here, you can see the current highest priorities based on my prioritization plan. As you can see, this is concentrated projects around the most populous areas in Lake County, and also areas that haven't burned in a long time, for example, in the Canocti interface. So just to clarify, this doesn't mean that the rest of these projects have been determined not important or taken out of the CWPP. We've just decided that these certain areas are the ones to focus on first. The prioritization scale goes in 8 levels, from highest priority to lowest priority. So many of these priorities are now considered high or moderate high, just not the absolute highest. This is a process to address management areas and steps. And this segues into what's next for Lake County. So one good thing to come out of the wildfire emergencies is that community members have come together to address this problem because it affects everyone. They have formed fire-wise communities, 2 fire-safe councils, and municipal advisory councils across the county that are intended to address general risk as well as communities' wildfire protection needs. These community groups and nonprofits like Clear Lake Environmental Research Center are working with state and federal agencies to obtain grant funding and get projects done. With a shortened list of high priority projects and accurate maps of group and agency jurisdictions, which I also worked on, collaboration becomes easier. So for example, here you can see 2 mapped fire-wise communities in the Rivieras, and you can see their proximity to the highest priority areas along Mount Canocti. So an example of a project that's being done that addresses this is Riviera West and Riviera Heights have been awarded money from Clerk from a CAL FIRE fire protection grant that was granted a couple years ago to remove hazard trees and treat existing fuel breaks. They initially planned to treat the fuel breaks with hand crews, but in order to prioritize removing hazard trees along the highest priority evacuation routes, which are along Soda Bay Road and which lead to Soda Bay Road, they invested in a hoof crew instead, a bunch of goats, which some of you may have seen, and goats are cheaper than a hand crew, and they're also much cuter, no offense to anyone who works on a trail crew out there. But this is just an example of a successful community, nonprofit, and state partnership that we could do more of now that we have a more organized system for addressing these projects. So adapting to wildfire is going to require strong interagency relationships and creative solutions. Good data management, visualization, and sharing is essential to that process. The Clerk website has more information, but for now, that's all from me.
Thank you very much for that presentation. Anything further, Supervisor Pyska?
Yeah, as you can see, Laurel, working with Clerk, was able to accomplish a tremendous amount of work this year. I just want to talk about the collaborative that we're building with the Risk Reduction Authority that Supervisor Simon and I are really expanding that collaboration right now and building it so that we can support this type of work. As Laurel talked about, just breaking down those silos, increasing the cooperation, engaging the community. This is all the energy and the momentum that we need to continue with the Risk Reduction Authority and all of the other groups that are participating. So this is just one example of the work that we kind of, Laurel and Clerk did most of the work, but through the Risk Reduction Authority and with that input from the people that attend those groups and the FireWise groups and the municipal advisory councils, and now building the Fire Safe Council. So I just want to applaud this work. I wanted to show you actually something tangible that's come out of this year. And I'm not sure if Supervisor Simon has anything else to add, but I'm very, very proud of the direction that we're moving in Lake County. And I'm super proud of Laurel, and I'm so excited that she is going to stay here. And she's also going to help mentor the new Spark that's going to start in September. So very, very excited and proud. Thank you.
Yeah, I think just to follow up on that, Jessica, as you talked about the Risk Reduction Authority, bringing folks to the table to break down those silos and communicate with each other. I know working directly with Laurel, we did the Broom Buster program down in Middletown, which is a lot of hard work, but it worked out well. It was nice to get out and have a community event. But engaging with the community advisory committees, the Middletown Area Town Hall, I know she with Cobb Area Council, she attended everything to gather that information. And what I also appreciate about Laurel was the engagement on the tribal nations throughout the county, and also looking at all of the fire lines and other things we've cut in the last decade here to get those GIS mapped, to understand exactly where the fire breaks are, so we can really get those things down and look at a maintenance program, not just cutting the brakes when the fires are happening and then going back to them when they're going. So maintaining those things and protecting our communities, which I think at this point, most of our communities are surrounded by these fire breaks, how important they are, that we really look at maintaining and, removing vegetation within them, but giving ourselves, a fighting chance with these firestorms that have been happening over the past decade. So I'm excited about the update of the Community Wildfire Protection Plan, so we can have those projects laid out and funding really focused on to make the most impact in those areas. And I completely agree with the assessment of the Rivieras being a focus that we need to really concentrate on, and I know that's in your district, Supervisor Pyska, and part of yours, Supervisor Scott, that we just continue to protect our community and our individuals as much as possible. So thank you for all the hard work, and I know you're going to continue doing that through Clerk.
Thank you very much for those comments. Supervisor Crandall?
Yes, Laurel, I'm glad you're staying with Lake County. I appreciate all the meetings that you attended with the MACs. I know that you attended 2 times, probably each MAC, because at certain times we didn't have enough people during we started the MAC meetings on Zoom, and so we didn't have enough people. She came both times and gave all the information. And so, yeah, and thank you. I didn't know that she was working with the tribes. That's a good thing. It seems to be a popular topic today, so it's a good thing.
Absolutely. Any further comments from the board? I just want to add that I know that I've worked a little bit with Laurel, especially on the backside of the city of Clear Lake when I met with her and Clerk Will Evans. Really appreciate the fact that you're doing so much to help protect our community and taking this 2009 plan and updating it with the latest and greatest information on how to best prepare to mitigate fires. Fires are going to happen. It's the idea of how do we mitigate them so we can control them to a size that is manageable. When we see these 50,000 acre or even the gigafires, the million acres like in Mendocino National Forest, it's just not manageable. At that point, you are trying to save lives. You're not taking the fire out. It's just an impossibility. So I hope that we can get this finalized and put to action as quickly as possible. And I hope that Clerk will remain and stay with us to help us get those grants from the state. I think they've been the most efficient group in using those grants. I know that if it wasn't for Clerk, we would not have had that 400-foot vegetation clearing in the east of Clear Lake next to the landfill to help protect the city from possible fires. So I appreciate your efficiency. I appreciate the work you're doing. This is absolutely, it's not a topic that dies during the month of December or January. We're thinking about fires all the time, and this is really important. I'd like to think that I did help Laurel a little bit. I did send her my GIS mapping. I think I taught her what not to do. So at least she made sure to do it the correct way. Your mapping looks impressive. Thank you so much for the work that you've done. All right, let's go ahead and open it up to the public. Anybody wish to speak on this item? Seeing none in the Zoom room and none in the chamber. Again, thank you so much for your presentation.
Mr. Chair, can I recommend a break?
Yes, you read my mind. We will be taking a 10-minute break. We will reconvene at 11 a.m. Check, check. All right, it's 11 a.m. Looks like everybody's back on, so let's go ahead and keep moving. We are on item 6.5, our 10:30 a.m. item, presentation of 2021 Drought Clear Lake. And Director De Leon, I believe you are taking the lead on this. I don't know if you went online. There you are.
Yeah, actually, I'm going to defer, and I think we're going to go ahead and start with perhaps Marina or I think Marina or Dale there in the court, or in the...
I believe we're going to start with Dale. And if you want to take the front seats rather than the podium.
Good morning, Dale Carnathan, Lake County Sheriff's Office of Emergency Services, Emergency Service Manager. We're here today to do a presentation about the activities of the Drought Task Force that was generated by a combination of agencies and is being participated in by multiple jurisdictions, both cities, the county. Some of the tribal representatives have also picked in special districts, as well as the State Drinking Water Authority and the State Department of Water Resources. We've also had the assistance of some Civic Spark fellows. Okay. I'm used to throwing my voice, so we've had the assistance, and one of those folks will be making a presentation via Zoom today. So with that, I will turn it over to Marina, and I'll stand by to move in.
Yes, good afternoon, board. Thank you so much for having us. My name is Marina Delajanis, and I serve as the Deputy Water Resources Director for the Lake County Watershed Protection District. As Dale mentioned, we are here today to provide an update regarding our July 2021 drought update. We have a few friends who will be joining us, so with that, I am just going to go ahead and dive right in. So, as we know, just to set the stage for us, drought is generally defined as a deficiency of precipitation over an extended period of time, usually a season or more, resulting in a water storage. So as we know, California is no stranger to drought. It is a reoccurring feature of our climate, and we recently experienced the 5-year event of 2012 through 2016, and along with other notable historical droughts, including the drought of 2007 through 2009, 1987 through 1992, and 1976 and 1977, which we will be referring here in the next few slides. And on and again, and off and on dry conditions spanning more than a decade in the 1920s and 1930s. So just a little bit more about drought. So they can cause public health and safety impacts, as well as economic and environmental impacts. Public health and safety impacts are primarily associated with catastrophic wildfire risks and drinking water shortage risks for small water systems, which we'll be hearing about in the next few slides. Examples of other impacts from drought relates to cost to homeowners due to loss of residential landscaping, degradation of urban environments due to the loss of landscaping as well, and agricultural land fallowing and associated job loss. Degradation of fishery habitat and tree mortality with damage to forest ecosystems as well. And here on the slide, you can see a few graphics of the drought as it relates to long-term drought in the West impacts to water supplies, and as it relates to increase of wildfire risk, which we previously heard from Laurel with Clerk on potential impacts. And then here on the left, we have a graphic from the New York Times as it compares to the drought conditions of June 2021 as it relates to the following previous years. So now I'm going to pass it over to Dale to do just to cover very specifically about our declared drought that we recently declared from Sheriff Martin.
Yes, the sheriff declared a local proclamation of emergency on May 6th, which was ratified by your board. Subsequently, that was forwarded to the governor. The governor has added the county of Lake to his declaration. And the U.S. Department of Agriculture has also proclaimed that the county is eligible for drought assistance for agriculture purposes. Unfortunately, the state's proclamation, while we did ask for California Disaster Assistance Act assistance the governor has not yet opened up the coffers of the CDAA. His proclamation basically asked or ordered state agencies to provide physical or material assistance to areas that were suffering from drinking water shortages and agricultural water shortages, and encouraged the state agencies to improve and change some of their water restrictions or their water allocations processes so that those areas could receive more water regardless of the other conditions that were associated. So right now, while we have a local and a state proclamation, we're not eligible for any funding other than individuals in agriculture. And as I've read the Stafford Act that provides national or federal disaster relief, drought is not considered an emergency under the Stafford Act. So all the funding that we may become eligible for is going to have to come through the state.
All right, so again, just funneling into our current Lake County drought conditions. So the U.S. Drought Monitor is updated each Thursday to show the location and intensity of drought across the country. And what the USDM, the U.S. Drought Monitor, use is a 5-category system from abnormally dry conditions to exceptional drought conditions. So the USDM is a joint effort of the National Drought Mitigation Center, USDA, and the NOAA. And I will have a link at the very end of this presentation for folks to check out the drought.gov, which has a wealth of knowledge regarding drought, and then of course the specifics as it relates to Lake County. So as you can see in this graphic, and I apologize if it's difficult for folks to see, the majority of the county is identified as exceptional drought, and then the northern part of the county is extreme drought. So from when this presentation was created last week, we have jumped up a little bit. So 100% of Lake County is identified as extreme drought. And again, this is the slider blue up top. And then 74.03% of Lake County is rated as exceptional drought. And then just again, looking into the specifics of this, again, this is from the drought.gov. They do update their data every Thursday, so I highly recommend folks to continue to check that out. Not only can you see how drought is affecting us here in Lake County, but the Western United States as a whole. So just funneling into some of the specifics. So over 64,000 folks in Lake County are affected by the drought, which as we know, that is, if not all of our community. 100% again of Lake County is affected by the drought. And then the 47th driest June was in 2021 over the past 127 years. And then we are at the 14th driest year to date in 127 years occurred in 2021. Looking at some of the precipitation, so this slide was presented when we did declare the drought in May. Again, I would just like to highlight our current precipitation at 12.28 inches of precipitation here in 2021. We don't anticipate we'll be getting a whole lot of precipitation. We can cross our fingers that today we might get a few sprinkles, but we don't anticipate that that number will be jumping up drastically in the near future. And again, just looking at some of our related dry years, in 2014 we received 17.89 inches of precipitation. And again, looking at 76 and 77, we were at 12.19 inches in 1976 and then 12.46 inches in 1977 of precipitation. So how does this affect our lake? So again, this graph was also shared in May. We have done some update, and this graph is on our Water Resources Facebook page and also on the Water Resources website. We're actively updating this as the days go on. So we can see here the legend in the red triangles right here. That is the predicted 2021 adjusted to the 1977 trend. The blue triangles is the predicted 2021 adjusted to the 2014 trend. And then these black triangles that we're looking at, this is the predicted 2021 calculated predictions. So I would just like to outline this disclaimer that these are predictions. So these prediction values were derived from the simplified Penman formula for evaporation rate. Again, these are only predictions, so this just gives us a rough estimate on worst case scenario. So looking into the future, worst case scenario, we would be at negative 4.02 in November. Best case scenario, we would be at negative 1.78. Again, I would just like to reiterate that these are predictions. This black line right here, this bold black line right in the middle, this is our current stage height. And it is anticipated that on the 1st, we would be at negative 1 Rumsey, so landing between this blue triangle and this black triangle right here. And I'm covering this section regarding our public boat ramps. Unfortunately, Director Lars Ewing with Public Services was not able to be present today, but I did receive an update from him. So here is the status of our county maintained ramps and their status. So we only have 2 county maintained ramps closed. That is Lucerne Harbor and Keeling Park. Crystal Lakeway Extension and North Lakeport, also referred to as the Hamilton Boat Launch. And they are not closed, but we are in close communications with our Marine Patrol as well. We also have our Quagga ramp monitors who are out on the boat actively speaking with fishermen, etc. So we're in close communications with Public Services, with the cities, and with Marine Patrol in terms of the closure of the ramps. So if any of these public boat ramps were to be closed, we would be making that notification on Facebook. If you have any questions regarding county maintained boat ramps, please feel free to reach out to our Lake County Public Services Department. And then we also have some information on our city boat ramps as well. So the city of Clear Lake and the city of Lakeport, both of their ramps are still open to the public. Again, we're keeping a close eye on them. And both the cities and the county are in very early conversations and possible ramp extensions. Again, that will take some time, so please stay tuned from the county on that if we have any headway on that. And now I will be passing it over to Scott Hornick with Special Districts to go over our water use in Lake County from our water purveyors.
All right, good morning. I am Scott Horning. I'm the Deputy Administrator for Special Districts. These are just showing some comparisons of water production from last year compared to this year. We have basically 3 systems that are using right about what they used last year at this time. We have one system, Spring Valley, which is using about 10% less than we were last year at this time. And then we have Kelseyville, which is using about 9% more than we were last year at this time. We have identified a leak in Kelseyville that we're working to get a contractor on board so we can make that repair and do away with that leak and hopefully tighten those numbers up a little bit better. But we still have room for conservation and water saving. There's some other comparisons there from California Water Service as well as Golden State. Fairly similar trends to ours. They're using maybe slightly a little bit more than they were last year. So again, there's conservation and water savings that can still be done out there. Currently, Special Districts is in our stage 1 of our drought plan, which is a voluntary 20% reduction that we're looking for from the customers. We have conservation tips and information are located on our website and our Facebook page. We have a link to the saveyourwater.com, which has a lot of good information and tips on saving water and conserving. We're also pursuing funding to extend our 2 lake intakes, as well as get backup wells for those 2 systems, as well as pursuing a possible backup well for Spring Valley to give us some redundancy. We are working to get a contractor on board to lower the intake at North Lakeport. Currently, it's right at about minus 3.25 Rumsey. We're hopeful that we can drop it maybe 2 to 3 feet to get us down under that minus 5 and hopefully be safe for this summer. The other water systems are all increasing advertising to get people to conserve more. They've got some rebates for high efficiency fixtures and things, and we're just trying to do our best to get people to save water and conserve it.
Thank you, Scott. And now I will be passing it over to Craig Weatherby, Director of Lake County Environmental Health.
Good morning. Thank you for letting me take a look at this slide. We took a look at all the wells that have been permitted for this year, and we wanted to see how that compared to previous years. As you can see, 2021 is shaping up to be the largest number of private wells being sunk in Lake County. We're looking at 133 as of July 22nd. We anticipate that number will close close to 200 by the end of the year. We are seeing a lot of wells being put in. There was a huge push in wells between May and June, which we believe was fueled by speculation of wells, the idea that wells were going to be stopped. So a lot of the drillers were putting those wells in. On the right side, you'll see a picture of Lake County. Wanted to demonstrate that we have actually received reports of wells going dry, although they are at a regional level, not per address. So really it looks like the south end of Lake County is really the primary focus for wells drying up. So far, this is not in their drinking water. This is in their agricultural wells for livestock watering and so forth. But this is kind of the tip of the iceberg. We are going to see more failures, and it is likely going to continue in the South County and will eventually work up into the North County as well.
Thank you, Craig. And now we will hand it over to another AmeriCorps Civic Spark Fellow, Marlis Jean, who will be going over the Lake County Drought Task Force.
Thanks, Marina. Hello, everyone. My name is Marlis. I'm here to just briefly talk to you today about the Drought Task Force, which is just a part of the project that I was helping pilot in Lake County. So I'm essentially piloting some pending legislation that would require the development of water shortage contingency plans in a situation in which water may run out. If it's a dry year, a drought year, this is not a requirement yet, but there's a suite of recommendations that includes the formation of something like a drought task force in regions where they might be susceptible to drought. So that's what I came in to do. I essentially gathered folks who work in the region in water resources, and together we've been meeting for the past about 12 weeks or so. And it's right here is our mission statement. It's really designed just for us to have conversations around the table to reach some goals for the protection of safe drinking water, for public safety, for the economic vitality of your region. We know how important Clear Lake is to Lake County, as well as fire protection, also extremely important, agriculture, for many reasons. There's a lot of reasons why it's important to preserve your water resources, and so that's the ultimate goal of this group. If you shift to the next slide, Marina. So it's essentially, like I just mentioned, it's a group of we're all volunteering our time to meet on a weekly basis to work collaboratively and identify potential solutions for where there might be high vulnerabilities. And so some of the conversations are really just around like, how are your customers doing? How are folks on their own private wells doing? We are trying to promote consistent regional messaging about water conservation. You may have seen signs here and there around the county about the fact that we're in a drought. It's important to save water. Really, it's just a space for folks in the county to come together and exchange their knowledge and resources. And then this is just want to make very clear, it's not a board-appointed committee. It's a group of stakeholders who, like I mentioned, voluntarily meet up on a weekly basis to discuss these goals and just, have kind of this knowledge sharing, this space for knowledge sharing, like I mentioned. And so these are some participating members. There's tribal representatives who attend these meetings. There's folks from the county who sometimes come to these meetings. There's cities and other local purveyors from around the county who attend. And a lot of folks, operate their, on different sizes. They have different number of staff. They have different resources at hand. So it really is just a space for sharing resources and knowledge that has been really helpful for a lot of these folks. So here's just a little snapshot of some things that have come out of these meetings. You may have seen some buses driving around the county that have some signage on the side of them, some public service announcements about the drought, how you can save water. there's a couple of changing message signs like around the county, the Caltrans signs that indicate that we're in a drought right now. There's some marquees and billboards across the county, including Robinson Rancheria, as well as Twin Pines Casino. There should be some like messaging you see up there. A couple of fire districts in your county are putting messages up on their marquees to indicate that we're in a drought and it's important to save water. There's also a Lake County Drought Task Force Facebook page if you care to look that up online. And of course, this presentation and the future outcomes of this group that's working together includes potentially a letter to you all in the future with some recommendations we have, which would be the next slide. Some things that we discuss and some things that we're hoping to continue to discuss as we move forward with this group is well drilling accountability, just making sure we know where all the wells are going in the county and where they have gone in the past. Just literally having data on where wells are is a great way to manage your water resources and understand where vulnerabilities lie, as well as strengthen and criteria for environmental review of permit applications, particularly when water usage is a huge component of that. If it's an agricultural operation, it's best to understand how much water would be used for a project like that. So understanding how it might impact the aquifer or other water resources around it. And ultimately, public outreach and education, like I mentioned before, just spreading the word. We're in a drought. It's important to save water. How can we consistently message across the lake, across the region, across the county? And at the end of it all, we're just hoping that you, the Board of Supervisors, support the work that we're doing as a working group and can help give us guidance on how to move forward so we can continue to make sure that Lake County has a viable water source moving forward in these dry years we're probably going to encounter.
Thank you, Marlis. So just to piggyback off of the Drought Task Force recommendations, the next steps for us here at the county level. So again, we anticipate, since it is a declared local emergency, we anticipate that we will be coming back to the board at the end of summer, early fall for another Drought 2021 update presentation, just following the presentations that we've done in the past and then the one today. As Marlis mentioned, the Lake County Drought Task Force, again, which is a work group, we have drafted a letter to the Board of Supervisors with some recommended voluntary water conservation measures. As some of the folks on this presentation have outlined, some of the water purveyors have already recommended from their users for voluntarily water reduction. But again, we'll be bringing that letter to the board in the near future on behalf of the Lake County Drought Task Force of that letter to the board to present those voluntary recommendations for review and approval or guidance on that letter. And again, Marlis, as she mentioned, continue public outreach and engagement. This is probably one of the most important things that we can do. I know that a lot of the counties, cities, water purveyors, et cetera, tribal representatives, they have been able to share resources and information. Same with our friends at the state and federal level as well. I will be including some of these resources in the next slide. But just getting the word out there, getting these resources out there. There are some things that folks can look up on how to save water, how to conserve water. As mentioned previously, drought is not a new thing for California, but it is something that we should always keep in mind, whether we're in a drought or not. It is important to conserve water. You know, we only have the water that we have here on this planet, so it's important to just be water wise all the time. And again, we'll be coming to the board in the near future for support of and direction from the board for the continuation of the Drought Task Force work group. So as Marlis mentioned, this was something that she was able to work collaboratively with her Civic Spark fellow, Bethany, who I believe is also on this call. This was their idea to get this work group going. This is something that Marlis mentioned will be in the near future throughout the state. We'll see a lot of these work groups pop up. So hope you just gain some support and guidance from the board if this is something that we would like to continue. I know that there is strong support from the representatives of the Drought Task Force, as Marlis mentioned. We've been meeting for the last 12 weeks or so, and there is a lot of support from the current Drought Task Force volunteers to continue on with these conversations. How that looks like, that's what we're still looking at, and hoping to provide some guidance and support from that. So moving forward, here are some of the resources that we have that we've been able to get information from this presentation, and just as we've been able to have these conversations and collaboration and whatnot regarding our drought, how it's looking currently, what we can anticipate in the future. We are also here at Water Resources are working on one drought hub that we can link pages to environmental health. If you want to report a drought, your well going dry, or special districts, or the water purveyors. So once we get that up and going, we will be sure to share that with the community via Facebook, and of course have it on our Water Resources page. So folks can just go to one landing page and have resources to, whether it be the California Department of Water Resources. They also have some very helpful information, and I know that they have been a strong support of this Drought Task Force work group. They have information where you, as a community member, can report if your household, your private well has gone dry. Of course, to save our water, they have all sorts of tips and tricks to just be water-wise all the time. And then again, a lot of the information that we shared today regarding the statistics were from drought.gov. With that, we also have our information here with the county. If you have any other questions, please feel free to reach out to us. We're more than happy to answer any questions or help point you in the right direction when it comes to being water-wise and just our current drought conditions. So with that being said, I am going to stop sharing my screen, and I will open it up to any other folks who are on this, who helped with this presentation, do any final parting words before I pass it back over to the board.
Are there any other members from the Drought Task Force that wish to speak before we open it up for the public? That would be you.
Not part of the task force, but I'll give the CAL FIRE update.
Please.
Can I steal yours?
You're unlisted, but you're on the task force, yes.
Okay, gotcha. Okay, good morning. My name is Jay Cannon. I've met probably most of the board here, most of the folks attending. So I'm with CAL FIRE. I'm a battalion chief in Lake County, and I've been asked to give a quick CAL FIRE update. So first and foremost, I think where the drought's affecting us is the fuels condition. I apologize in advance for this graph. You're not going to be able to read this, but it details out over the last year and a half the fuel content, or the moisture content of our fuels. So the two of note for us are we pull our fuel samples from Canocti and Walker Ridge.
Hold on one second. If you can share the screen, because it's not popping up on Zoom.
Oh, okay, got it.
We all see it here. Little technicality. It's because it's up on the corner. You got it. It's open in the corner on the right. Up, up, up. There it is. There you go.
Thank you.
Yep. Yep.
Okay, can you see it on Zoom? I can't see it.
Yes, we can see it now.
Okay, great. Whoops, wrong way.
Hit present.
I'm on 3 screens, actually.
If you just click present at the bottom of that PowerPoint presentation. Because I could see it fine on Zoom. If you can click present.
Oh, that's not what I'm trying to get the full page here. Okay, and then F5.
Perfect.
Everybody got it?
Yes.
Okay, so the big items of note here, the Canocti fuel moisture numbers and the Walker Ridge fuel moisture numbers. So over here on the right is the current numbers that we have. Walker Ridge is sitting at 65% for the brush samples, and then Canocti is sitting at 72%. So a little bit of background on that, 60% is considered critical fuel moisture, where the live fuels will burn the same as a dead fuel. So we're getting pretty close to that. It's not unusual, it happens every year, but the thing that's different from this year, from previous years, is that we're reaching that point about a month to a month and a half ahead of schedule, so that it will affect us. Covered right there. All those fuel samples were taken on June 30th, so we should be getting new fuel samples here in the next few days, and so we'd anticipate, of course, that those numbers are going to be lower. CAL FIRE's current resource status, just wanted to touch on that. We have the Dixie Fire, Tamarack Fire, and the Park Fire. Dixie and Tamarack are both large acreage fires, and they're drawing a lot of resources away from the county. We generally run 2 engines out of all of our local CAL FIRE stations, and right now we're down to 1 because of the resource needs on the other fires. One thing I would add, a point of note, is that since we are a state agency, if we did get a large scale or significant event here, we would be drawing resources from surrounding counties and most likely back from some of these fires as well. Crew strength, right now we're sitting the same as we normally do. We have 2 crews. We have the Canocti crews, and what's added last year was the Blue Ridge crews. So the Blue Ridge crews are no longer incarcerated hand crews. We're running those with firefighter 1s, and we're seeing pretty good success with that new program. The other item of note here, I'll move on to the next one. We just got our new helicopter up at Boggs. So the new helicopter is a Black Hawk. We're calling it the CAL FIRE Hawk, or S70I. The identifier is still Copter 104. It's got a 1,000-gallon tank, and so that increases the capacity of water that we can put on a fire by just about a factor of 3, so that should be a great benefit for us. Additionally, that has an affixed hoist, so we can do it increases our rescue capabilities as well. As far as the drought augmentation, the governor approved $80.74 million to augment our firefighting capabilities. Primarily, that's gone to almost 1,400 additional firefighters that we brought on. It also provided for an early hire of our firefighters that are associated with the aviation program to get them up and running, especially with the advent of the new helicopter. They need to come on about a month and a half early to take care of their training requirements. The rest of this money is going toward CCC crew staffing, the supervision on those crews, and then also the National Guard crew staffing. The bulk of the 1,400 firefighters will be distributed on Firefighter 1 hand crews, such as the Blue Ridge crews throughout the state. I figured I'd mention fuel reduction. I heard clerk come up several times during this conversation, and they're doing good work, and we'll continue to support them where we can. They've been entrusted with the maintenance of the Riviera's fuel breaks, so we call it the Mount Canocti Interface Project. I believe it was Lauren mentioned that earlier. Additionally, all of our CAL FIRE crews that we have available, they'll do fuel reduction projects, and primarily we're focusing on projects that benefit community protection as opposed to fuel reduction out in the middle of unpopulated areas. And then finally, the fuels crew out of Kelsey Cobb, it works from approximately November until May. It's 10 people on a fire engine. They go out and they do fuel reduction. So they're running saws, cutting, piling, burning. We've been assisting landowners with burns, conducting VMPs where we can, and other related work. And figured I'd touch on fire activity. So 2020, we all know that was a busy fire year. To date, in 2020, or up to July 24th, we had 4,854 fires for 118,000 acres approximately. 2021, we have had about 1,000 additional starts, so 5,500 starts for 456,000 acres. So we're already surpassing those numbers from 2020. One interesting side note there, however, until mid-July, we had more ignitions but less acreage than in 2020. So some of the discussions on that are effects of weather or our augmented initial attack capabilities were making a difference. And then the Dixie Fire started, and then now our acreages are much beyond what we had in 2020. Fire activity locally, no major fires to date. And I see one of the supervisors knocking on wood, and I agree. Majority of the fire activity has been up in Siskiyou, Modoc, Lassen counties, and Plumas, and that was due to numerous lightning starts in early July. And I would add those are a mix of federal responsibility area fires and state responsibility area, which they're still working on a couple of those. And that is all I have for you. I'll open to questions.
Thank you very much for your presentation. Any further members from the task force have any comments or presentations? All right, hearing and seeing none. If we can go ahead and end your sharing of the screen, if that's possible. Okay. At the very bottom, you should be able to get that.
Good.
Perfect, we are good. Let's go ahead and bring it back to the board. Any comments or questions from the board on this item?
Yep, I do.
Supervisor Pyska, please begin.
Well, I'm just curious if you think the new helicopter is helping with the keeping those small fires small, Jake.
So far, we've had pretty good success on the smaller fires. So I think the largest that they've responded to in the new helicopter is probably on the order of 50 acres or so. And ground crews have noticed a difference in the volume of water coming down to assist them. So yes.
Right, that's excellent news. So I just wanted to respond to some of the recommendations of the Drought Task Force. I am in full support of those recommendations, and you know, it's really important for us to look long term at the sustainability of our communities and our agriculture. And so taking a look at cumulative use is really important. And I was happy to see the Facebook page. I didn't know that existed. I got on there and I liked it, so now I'm following it, and I hope more people do as well. One of the comments that I continue to get is people will call me and tell me that their wells have run dry. And I encourage them to report it immediately. A lot of people don't know what to do or where to do that. So I'm just wondering if you could just put it out there one more time. Really simple steps. What do you do if you're experiencing well reduction or if your well's gone completely dry?
And Deputy Director Delagianis, is that possible for you to share with us?
Yes, I'm going to pass it over to Director Craig Weatherby. I see he unmuted himself.
Yes. So we absolutely encourage anybody who is suffering from dry wells to contact our office and make us aware of it. Simultaneously, you can also post your information using the My Dry Wells link that was provided. It is also available on Facebook. That information helps drive policy. Perfect time to get a phone call. I love it when my mom calls. Sorry about that. So yes, you can put that information. If it goes in there, that helps drive some policy. It can help get us revenue to help people with their wells. In some cases, they may be able to help recondition your well, add depth. Just a lot of different resources that can come to bear that, but we have to know about it. Right now, the reports that we are getting are from people, but they do not wish to share their location data, which I understand. However, all we have is just their general area that they're operating in, as opposed to their actual location, and it makes it a little bit more challenging to use that data to get the resources that we need to be able to help out. But if you are suffering from a dry well, either let us know or go onto that Facebook page, click on the links for My Dry Well to help report it, and see if we can get some resources to help you.
Okay, thank you. In the past, I know it was recommended to contact the ag department, but it's better to contact environmental health.
It goes in both directions, either the ag department or us. Either one, they're going to be able to present you with resources and help you out. The ag department, their focus is a little bit more on the agricultural products. So if your water shortage is related to your crops or something along the lines, absolutely critical that the ag department knows about that. If it's to your drinking water sources, we are probably your better resource in that regard, as we have our partnerships with the state water resources boards, things like that. So we have a little bit more of our goals are towards that end.
Great, I appreciate that. And just for simplicity, they could contact environmental health and you can walk them through the process of registering that with the state.
Absolutely, yes.
Great, thank you.
Thank you, Supervisor. Any other comment? Supervisor Scott.
I have a question more out of curiosity of why wouldn't somebody want to give their address that their well went dry to be able to get the resources and help that might be needed or coming?
Traditionally, people have been very private about their wells. They don't wish to share the exact location of their well, the condition of their well, how much water is at their well, what its recharge rate is. This is information that is proprietary to the landowner, and they're not always willing to share that information. That can be as a result of just, good business practice maybe, or there's always the threat that landowners always feel like the state is looking to control their water, monitor their water, put meters on their water and charge them for it. I've heard a lot of different things. The goal of this group is not related to that. We're looking to ensure people have resources when those wells dry up so that they're not left standing there trying to decide if they're going to have water for themselves or water for their livestock. We want to be able to make sure people have what they need in a safe way too, not just pulling water out of a creek and trying to sterilize it. So.
Thank you. And I'm with Supervisor Pyska. I fully support the task force coming to us with any measures that we could do to conserve water and, to educate our public. I think there's still many people out there that, need to be educated on how we can conserve water and best practices. So thank you.
Thank you, Supervisor. Any comment from others? So I have a few questions. Can't really take action today, but I think we can provide a little bit of direction. And one of the things that concerns me is the well construction numbers. There's two parts that concerns me is, one, it has the possibility to exacerbate the issues of regional wells in the area where a new well is dug, depending on what that well is used for. And right now, I don't believe that we differentiate between a residential well and an agricultural well. And I don't know if Director Weatherby can clarify that statement to make sure that it's correct, but from my conversations with him, I don't believe that there is a differentiation in the permitting process. And I think that we should at least make sure that at this moment in time, wells that are made for residential purposes should take precedence at this moment in time, and that maybe certain criteria need to be met for new agricultural wells to ensure that there's not going to be any kind of impact to the surrounding area before going ahead and drilling. And then my second part is, in my conversations with Yolo County Flood Control and with Director Weatherby, we do not have an ordinance that has a setback from creeks and other types of waterways for digging wells, which at this point, those waterways would almost be impacted directly by having those wells dug within a certain distance from it, and we don't have any setbacks from those things. And I'd like to see if maybe that's something we can come back to the board and discuss further. But Mr. Weatherby, if you could please clarify any of my statements that I made, or add to it, please.
Absolutely. So at this time, the mandate for Lake County Environmental Health is when we pull a permit, we do not take into account the use of the water, only the construction standard of the well. There are 3 types of wells that are provided a permit for. It can be either a domestic use, an agricultural well, or a public well. And again, the standard is only towards the construction of it, whereas a domestic well will differ from an ag well in the casing size, and a public well will differ from the other two in the amount of a sanitary seal being required at 50 feet as opposed to 20 feet. We do have mandatory setbacks to contamination sources. That's kind of the purview of what we're trying to prevent, is any contamination to those wells. So there are setbacks to things that you would expect, like a septic tank or a septic leach field, or perhaps like a hazardous material location. There are setbacks to that. However, those are really the standards that are in place. We do not have a setback to a creek at this time, and it is something worthy of consideration, because a well immediately next to or adjacent to a creek absolutely would impact the amount of water that actually makes it to our water sources like Clear Lake. So that's something to be considered.
And even though the construction is required to be a separate type of inspection depending on what they're looking to do, when it comes to the usage of the well, it can be used, a domestic well could be used for agriculture, or and I guess I'm asking a community development question, which would be, is a domestic well allowed to be used for an agricultural use? And I don't know that anybody on here has that answer. But that's, from what I understand, the answer is no. It doesn't have to preclude it from being used in that way.
At least not by our office. Again, we don't make a determination on the use of the water, only to the construction standard.
And so I'm looking at our board and looking if I can get consensus to bring this topic back. I think it's an important topic to discuss. Especially, I know that Supervisor Crandall and myself will be meeting with Yolo County Flood Control later this week. And hoping that we can bring some of those conversations back to the table as well. Their concern is mainly Cache Creek, because that's what they have the rights to, is Cache Creek and the lake. But I'm worried about all of other creeks that people might be more directly impacting by having wells right there. And granted, I don't think this would be a retroactive situation, but I think that in the future we need to be certain that we're drawing from a water table and not straight from a waterway, which impacts our lake, which then impacts the amount of drinking water that's available in our lake for the 65% of people. I thought it was 60, but I was corrected. It's 65% of people that draw directly from the lake for drinking water. I'm just looking for consensus for having that conversation. Okay, I'm seeing some yeses, and I see a no, but I have a consensus of 4 at this moment in time. So we'll go ahead and go to my next conversation, ramp extensions. I know this has been brought up, and it's part of our one of our objectives from the Drought Task Force. I know that we are waiting for some funding. Unfortunately, just from CSAC yesterday, I got another response that trailer bills are still in the works, guidelines are still in the works, and that the money that would be available to us is coming, but they don't have a specific date for when it would be available, and they would provide more information to me. But I'd like for us to have something that's project ready. Where are we with looking at that, Director De Leon?
Well, it's pretty much the same that we were a week or so ago when we talked about this. Director Ewing and I are pursuing that. There are some candidate ramps. You know, it's not a simple project to extend those, and some of them, what we're trying to do is find candidates that are a little easier, could be accomplished with something that's precast and require minimal impacts or effort to the lake bottom to prepare. And you know, we're in the kind of preliminary engineering phase of that, and that's ongoing.
Okay, appreciate that update. I was also wondering if, I see we have Brenna Sullivan, and wondering, and I know she's part of the task force as well, what is the strategy for the Farm Bureau when it comes to cattle versus crops? I know that I've heard of some strategies happening in the Central Valley. I've not heard specifics here on the difference and what our strategy is.
Supervisor Sabatier, I'm sorry, can you repeat that question? My feed cut out right when you were asking it.
The strategy from the Farm Bureau on helping our agricultural folks when it comes the strategy difference between cattle and crops.
I would defer that question to the Lake County Ag Department if they're on. They have been attending those drought task force meetings on behalf of agriculture. I don't know if they're on. If you would like, I can get some more specific information on that for the next meeting.
Yeah, and I don't see them on, and I apologize for directing the question to the wrong person. I'll go ahead and reach out to them and make sure that when we come back to the public that I can provide that answer. And that's it for all of my comments. Any further comments from the board before we open it up for the public? And seeing none, let's go ahead and open up to the public. I know we had a person here with their hands up for a long time, and I can't see their name. Elliot Hurwitz, if we can unmute them, please.
Good afternoon. Good morning still. Thanks. Couple quick questions. I know that statewide ag accounts for about 40% of water use. Question is, do we know, or do we have an understanding of just what the percentage of ag water use is in Lake County, and how that might relate to new permitting? And following up to this, are you aware of any additional resources that may be available at this time for the kind of hydrologic studies that will allow us to evaluate the state of our local aquifers? I know we're talking about the number of wells, but a well can be there's a significant difference in the amount of withdrawal from well to well, and it seems like it would be very important as we go forward to understand how the well and withdrawals are affecting the state of our local aquifers. Thank you very much.
Thank you for your question and comment. I know we have spoken about water studies in the past. Definitely something that could still happen in the future, but at this moment in time, nothing has been initiated. As far as the question about ag use of water versus domestic use, I do not believe I have that statistic, and I think that the ag commissioner would probably be best primed unless there's somebody on here that wants to raise their hand and has that information available. And oh, I see somebody. And Deputy Director Delagianis.
Yes, so I do not have an answer to the latter question. I apologize, Elliot, but I would just like to go off of one of your previous questions regarding hydrologic studies, et cetera. I know that right now we're currently working for our Big Valley Groundwater Basin Sustainability Plan, and in that we are doing hydrologic models. We're in the process of developing that. That's related to our Big Valley Basin. As we know, that is one of our highest production in terms of agriculture. So in the next year, we will have a better idea of that. And as some of the folks on this call had stated, we are in close conversations with the state of California, trying to find active, funds and resources to develop more, just funding opportunities to develop hydrologic models along with ramp extensions, et cetera. So I just wanted to, elaborate on what Chair Sabatier said on that. So I don't have an answer though for the agriculture. I apologize.
No worries, but thank you for the additional information, and I've added that to a list of questions that I will try and obtain the answers to. And let's go and move on to the boardroom, and I see your hand up. We'll get back to you since you've already had a chance to speak. Let's go ahead and start in the boardroom. If you have something to express, please come to the microphone, and you have 3 minutes.
Joan Moss, I was just wondering if the Department of Fish and Game is involved in this. I see deer, squirrels. I wonder if they have water. Thank you.
Thank you. And I believe that I saw, not on the task force, I thought I saw their name up on the list of partners or something like that.
No, the Department of Fish and Wildlife has not been a regular participant. They would be represented through the state agencies
but they have not had any input into this document.
Okay, thank you. Anyone else with a comment? Please come up to the microphone.
My name's Larry Christensen, and I just want to say that a lot of the items that I had down here have been, covered very well. A lot of the planning and a lot of the drought task force, et cetera. But the one thing I'm not hearing is anything about, the effect on closing the ramps to tourism, which includes recreational, professional, and impacts hotels, restaurants, service stations, tackle shops, guide services. With closures come unemployment, come loss of tax revenues. So how are we going to address that? That's my question.
Thank you very much. And I know that Director De Leon touched on it a little bit. There is progress being made. Unfortunately, being in the state of California, and I'm not sure how other states operate, but I know California requires some environmental impacts to be done and construction design. I wish it was as simple as just laying something down to allow boats and trailers to go down, but we have to go through quite the process, and I'll let Director De Leon elaborate on that if he has more.
Well, yes, I mean, you kind of hit the nail on the head. It's, it's a number of issues, funding being one, and so let's set that aside and presume for a minute that we can find the funding. The environmental review is typically going to be very, very challenging, depending on the type of project that you're going to do. To extend the ramps, and Marina put up a slide in her presentation. The majority of the ramps that are still open around Clear Lake right now, the ends of those ramps is around -3 to -3.5 Rumsey. So some of these ramps are getting close to the point where boats that are larger, that require a few feet of water to float the boat off of the trailer, some of these ramps are approaching the point where they're not going to be usable. 5th Street in Lakeport is our deepest ramp at -5.3. It would be ideal if we could get the remaining public ramps down to -5, but that it requires dewatering. In some cases, we would have to do excavation to extend or lower the bottom elevation in order to get that. And so with that comes quite a bit of environmental review. I can tell you that Director Ewing and I, if there's an opportunity to extend a ramp and get that done while the lake is at its current state, we're certainly going to do everything we can to make that happen, because we are very mindful of all the things that the speaker just questioned. We're very aware of the lake and its impacts to tourism and all of the things that folks coming to Lake County to use the lake bring. So we're very aware of that.
Thank you
Can
for
I
that.
ask Director De Leon a question?
Please.
Does he have an estimate on how much it would cost to extend one of the ramps?
Those cost estimates are being developed. I don't have the answer to that right just this morning. Again, it depends. If it's a dewater cast in place, that's going to be a much more expensive project than perhaps dragging a precast assembly and just extending the ramp through a precast product. And there are a number of those that we're looking at, and so the price varies pretty significantly, actually, from perhaps $100,000 or maybe a little less than that, to hundreds of thousands of dollars for something that's going to be precast and formed and poured, and something that's cast in place is going to be hundreds of thousands of dollars with all of the dewatering and different things that would need to go into that. I hope that gives you a sense of the scope. Simple project being 75 to 100,000 and a complex project being in the hundreds of thousands.
Thank you for the question, Supervisor. Any other comments or questions? Supervisor Simon?
And just to follow up on the ramp conversation is, I think to respond to your question, yes, we're in the drought right now, but taking advantage of this as an opportunity to look at that long term. Hopefully what we can do is continue along this process of extending the ramps so the next time the drought comes around that we're prepared for it and we won't be closing ramps. That's the long-term goal. So I know when I mentioned this in the beginning, I appreciate all the hard work of the departments that were doing it, but what I would like to see, like we said, the long-term goal, taking advantage of this opportunity right now with the drought, get these things extended, and so in the future, there won't be closures. We'll just be able to extend them out, and have that opportunity, because as we all know, you said it greatly, the best asset we have here with the natural resources is our lake, and making sure that's accessible to everybody who wants to come enjoy it, even during a drought time, is the most important thing we should be thinking about for the long-term success of Lake County and all of our businesses that benefit from that beautiful lake. So that's my thoughts on the long-term vision.
Your time was up.
3 minutes is up. Okay.
And I do appreciate that Supervisor Simon did bring this up when we first talked about the drought. This was maybe about a month ago. I appreciate that staff from Water Resources as well as Public Services has followed up on this and is looking into it. One of my goals is that we have something prepared so that when our state unleashes the funds that they promised us back on May 12th, which unfortunately takes longer than we all would like, that we have a project ready to pull off the shelf and say, here's what I need your money for. And I think that's going to be the easiest and fastest way we're going to get it done. And so I appreciate what staff is doing, but I understand from the public perspective as well from my perspective that it is so difficult to be patient with these types of processes. Had we dealt with this back in 2014 in the previous drought to have a project ready situation for extending the ramps, then we would be able to pull that off the shelf, and we need to be better prepared and more forward thinking than we were back then, and having these types of projects ready. So here we are doing the right thing. It's just a matter of timing. And I will...
One more last comment, Mr. Chair, too. Another opportunity, especially with the CSAC representative, RCRC representatives at the state level, is, just as CAL FIRE does when we have a fire emergency, obviously you get the work done. Whether you're cutting the fire lines or other things like that, there are some other things to do during an emergency situation. So maybe some of the larger hurdles that we've been talking about with the environmental review and other things, you can push that conversation. This is a current emergency. So why can't there be some releasing of those requirements for those environmental studies and other stuff? So I would just encourage you to have that conversation at the state level, that we should look at it the same way as an emergency, that we do during the fires. You battle it. CAL FIRE or local fire departments do that in the emergency situation and get some things done that usually take a long time to get done. So maybe this opportunity with the drought will open those doors also with the environmental review. So please have those conversations.
Absolutely. And I'm hoping that this is also an opportunity for the Middle Creek restoration. It's meant to be a storage project as well as a flood control project and a water quality project. And so to extend the water storage so that CAL FIRE has access to more water to be able to fight fires, we need to work on those things all simultaneously. So there's a lot of opportunities that unfortunately do come because of the crises that we deal with here in Lake County, and hopefully we'll take advantage of as many of them as they come down. Any further comments from the public here in the boardroom before I go back to the Zoom room? You really don't want us to talk longer than we... Any further public comment from the public? All right, seeing none, let's go back to the Zoom room, and I see a new speaker, Betsy Kahn. Let's go ahead and start with you.
Thank you, Mr. Chair, and thank you to the board. Thank you to everybody on the Drought Task Force. I would like to mention that FEMA has sent a notice of funding availability for up to, well, the total amount is $1 billion, which is for public assistance. And I was told by our FEMA mitigation specialist at Region 9 that that money would be available for improving our fire suppression systems, which we know have an enormous number of problems. This is a piece of information I've passed along to the Risk Reduction Authority, to the Special Districts Department. I did not know who to contact on this disaster, this drought group, but I think if you can look at that, it would be an incredible advantage to us. We have many, many, many systems that are inadequate, as we have seen in the fires recently this year in places like Clear Lake Oaks. Scotts Valley residents have no fire hydrants. And so I would urge you to please take that into consideration. Special Districts Administrator Scott Harder has that information as well. Thank you.
Thank you very much. Supervisor Crandall, did you want to?
Yes, actually, I was going to, sorry I didn't bring this up earlier, Director De Leon. I was just going to state that the Lucerne Harbor project is underway. I know there's still some other licenses that need to be applied for, and I'm not sure how it looks if we wanted to add extending that ramp to the project. I know it probably would slow it down, and so I just, maybe we can talk offline about how that looks or something like that, and if not, we just push it down the line. But I would rather, if we can make it happen, it'd be nice, at least with one of them. So just thinking about that.
Yeah, I can't speak for Director Ewing, but certainly now would be the time if that was something that you wanted to entertain, and be happy to discuss that offline with you.
Okay.
All right, thank you for that. And Elliot Hurwitz.
Thank you for taking my comments again. Again, echoing the sentiments that Supervisors Simon and Sabatier have said. I think you're right about taking advantage of the opportunity of the current drought, recognizing that these are conditions that are we're not going back to kind of, previous normal conditions, but given the kind of climate trajectory altogether, this is something that we're going to have to deal with significantly over the coming years. And so my question is, how are drought conditions and kind of proposed water use affecting our consideration of new development permits altogether? It seems like this is something that should be of significant, a significant dimension as we kind of consider any new development. Thank you.
And I will point you in the direction of our agenda, where item number 6.6, which is our next item, is regarding that very sentiment that you just expressed. And so I would say hold on to that sentiment and come back to that item.
Thank you.
And then our last hand up that I have is Brenna Sullivan. Sorry for not seeing you. You are one of our panelists, so I appreciate that.
Thanks, Supervisor. I just wanted to quickly circle back to the livestock question. I can't speak to any specific county efforts through the Drought Task Force, but just in case there are livestock producers that are listening, there are drought assistant programs for them through USDA's Farm Service Agency programs. There's specific drought disaster assistance for livestock. And our local office is in Ukiah. The number is 707-468-9223. Thank you.
Thank you so much for that information. And seeing no further comment in the boardroom and no further comment in the Zoom room, let's go ahead and bring it back to the board. I know that there were 2 supervisors that agreed with the recommendations. I'm just looking, is there a consensus to agree with the recommendations that were proposed to us during the presentation? Yes. Okay, I'm seeing a consensus, and so thank you very much for the presentation, and we will have another presentation in the near future. Appreciate all your time and efforts. So we are 12:09 p.m. Let's go ahead and tackle item 6.6. 11 a.m., consideration of an urgency ordinance requiring land use applicants to provide enhanced water analysis during a declared drought emergency. So I brought this to the board today as I've been listening for the past maybe 2 months, if not more, been listening to all of our planning commission meetings. We've had an appeal come to us where I was somewhat concerned that we had numbers provided for well reports, but no actual well reports, and it just felt like the water analysis to me was lacking a full, thorough analysis during the CEQA process. I've also been hearing, this was the second time that it was said in the last Planning Commission hearing, we are looking for the Board of Supervisors for guidance on the drought situation. And so what I bring before you is a water use ordinance, urgency ordinance, that would mandate a hydrology report be submitted for all projects that have water use in it, and also a drought management plan. These things right now would just be during an urgency, but I'll just be very honest with you. I think we need to vet this a little bit more and looking at making these a permanent standard, because it would be nice for all projects to say, this is what I can do during a drought to have, we're asking our consumers of water to reduce their water use. The projects should have an idea of what they can do in order to reduce water use. And I think it's important that we take a look at those things and that those things are being thought about in the idea of new activity and new land use planning. Hydrology report is important to not just know what kind of gallons per minute you have coming out of your well, but also how does that impact the hydrology of the area? And I think that it's important that we get that level of reporting, and in my opinion, it does not deviate from what CEQA actually states should already be happening, so I don't think we're adding anything that is out of the ordinary. I think that a hydrology report is part of CEQA analysis of a project, and so I found this important to respond to the Planning Commission, who looked to us for direction, and bring this to your board for discussion and seeing if this would be considered.
I have a comment. I appreciate you bringing this. I heard that loud and clear at the Planning Commission as well. We have an opportunity to be proactive with this issue that we've got. You know, we have a lot of opportunities in our county right now, but if we don't have water, we don't have anything. It was pretty eye-opening for me today to see the amount of new wells that are going in, and it's important for us to kind of step back and make sure that we're going to be in a place that we can sustain this type of development. So again, I do appreciate you bringing this. I have a question. Who's going to be reviewing these reports? If an applicant is bringing in a hydrology report, then who on our side, from the county's perspective, is going to be reviewing that? And do we need to contract that work out with a third party?
So I think that it's always possible to contract out with a third party, but at this moment in time, the CEQA analysis is supposed to be done in-house, and the analysis brought forth to the planning commissioners. I do not know if that's what's happening 100% of the time. I think sometimes we do contract out for certain aspects or certain parts of projects, but I don't want to misspeak and state that this would be contracted out automatically or analyzed in-house. But I believe that the majority of the time it is all analyzed in-house. And is there anyone that might have better clarified information on that? Ms. Grant.
Thank you. Well, certainly staff would be analyzing it in CDD, but they also can contract out various of the environmental reviews. Staff has to be in a position of peer review and doing their own analysis once they receive that, not reinventing that same wheel, but rather reviewing it and being comfortable with the outcome. So that type of collaboration is not at all unusual.
Thank you very much.
Thank you.
Any further comments or questions from the board? Supervisor Scott.
You know, I definitely agree with you, Supervisor Sabatier, that we need to be moving forward with this urgency ordinance today because we are in a drought. But I also would like to see this normally when projects come forward. So I agree with you. This is not the last drought we're going to see. As we've seen through our history, it continues. So we need to be making sure that we are doing the best for our community when it comes to water. And I also was I'm very surprised when I saw all the applications for wells being pulled.
Yeah, from what I understand, many well drillers are backed up till the end of the year almost with plans to drill more wells. So it's very concerning. Any further comment? Supervisor Simon.
No, I think, I think moving forward with this ordinance today is a positive thing. I know that we need to have more discussions though, because obviously it's twofold. When we're talking about all projects, having the extra water analysis and the water management plan now on some of our developers or even folks that are just attempting to survive during the drought with the conditions, with having to maybe drill a new well or other things. I want to take those all into consideration when we're having the discussions. And earlier you asked about bringing it back about folks that live on the creeks. We have a lot of folks that live on the creeks in this county, and they moved here or they've resided, their families here for generations, and that's where they live. And it may not be this generation, it may be the next generation where they have enough property where their son or their daughter can build a home on those spots. And we want to just take that all into consideration because ultimately we have discussions always about COVID-19, other things with government, and obviously with this opportunity, when you purchase property, you want to be able to utilize it as you feel fit to take care of your family needs. So I'm in support of it, but more conversation needs to be had because like yourself or others, I know we already have some folks that were reaching out today in some of our conversations that were already confused. We're restricting their opportunity to bring water to their well because they don't have any now. So we just need to have good communication and really get that out to the public on what we're discussing because fears are running rampant right now on what we're doing with water use. And I know we have many different industries that are using it in different ways, but you did speak to the fact that, if it's residential use and that's what you're using for, we got to just get that lined out to make sure we're protecting those opportunities for folks. So, in support, but more conversation needs to come back.
I appreciate the comment, and I agree that words have power, and if we misstate things, it does create fear because water is that important. It's important not just to our livelihoods as far as health, but it's also important to our livelihoods as far as economics. So it's important that we have those deep dive conversations, which is why today I didn't want to provide direction to Craig other than to bring it back, because I think it is important that we dive deep into the discussion because it's not that simple at all. Appreciate the comments. Any further? Supervisor Crandall?
Yes, I think this is, I'm glad you brought this forward, Supervisor Sabatier, and I heard them loud and clear in the Planning Commission meeting as well, and so I'm following some of those, and so to hear it a couple times is like, okay, we got to do something, so appreciate it, and I think I'm on board with it.
All right. Thank you very much. If there's no further comments from the board, let's go ahead and open it up to the public, and we'll start with Betsy Kahn.
Thank you again, Chairman Sabatier and the members of the board. I have several comments to offer here. I'll be brief, but I do want to get them all. First of all, I would recommend that you look at the Lake County Zoning Ordinance, Article 64, which is called the Environmental Protection Ordinance. There is a very, very old and very antiquated process for upon a 1970s and 80s product. It was called the Environmental Protection Guideline. I really seriously think you need to have that completely brought up to date so that you make sure that this happens properly. in the past, the initial studies were for when water resources, water resources engineer, Mr. Smythe, and it was his job to determine whether there would be an adverse impact of the new water use. But the County of Lake has never calculated what the Local Agency Formation Commission calls a safe yield of water supplies. However, there are documents available from the County Department of Water Resources people can look at, including the groundwater management plan, and that's another area I would really like to request that you look at the groundwater management ordinance, because it is not protective by a long stretch. Then you have on top of that all of your commercial cannabis applications in fragile areas where there are no fire suppression services. And that conflict needs to be addressed. I don't believe it is in the ordinance that you have for issuing those permits. So we would really like to see that added. And then the last thing I would say is that we have a large number of problems with the inability to manage the impacts on creeks because we do not have a county-wide conservation plan. Nor do we have a creek ordinance that protects the destruction of the banks, the removal of the gravel, whatever it is. And so I really believe you need to have that looked at as well. And if we're going to go through all of this exercise, it would be helpful to have the urgency ordinance call for the extra tasks that would be protecting our natural resources. Thank you.
Thank you very much. Next, we have a comment from Richard Knoll.
Good morning, or good afternoon, I guess. I wanted to comment on the proposed ordinance. It seems like it is well intended, but with all due respect, I don't think it is comprehensive enough. And one of the issues when you talk about a hydrology report, you really should define who prepares those reports. I think you have to mandate that they are prepared by a qualified and credentialed hydrologist, an engineer, trained and who specializes in that kind of thing. With respect to, item A, subsection A, in the urgency ordinance, there are additional sources of water, not just wells, that you need to account for. There is surface water, there is rainwater catchment, so I think you got to be more comprehensive in that regard. In terms of, I think what you're looking for is not only the recharge of the on-site wells, but also the aquifer itself. And then item C under that heading, hydrology report, it's not clear to me what the cumulative impact of the surrounding area is really looking for. I guess what I'm saying is that it seems to me that you want to look at what the cumulative impact is to the aquifer or nearby wells within a certain distance or something like that. With regard to the drought management plan, I just want to point out in the existing zoning ordinance, the cannabis ordinance, there is under the requirement for a property management plan, the preparation of a water use plan. And it seems like there's some overlap here. And I just want to conclude by saying that while I think it's a great idea, I do suggest that maybe you look at consulting with a qualified hydrologist to actually develop the scope of work of what you're really looking for here. It's a complex and critical issue, and I think going to that expert might make some sense as you develop what
your 3 minutes are
the
up.
scope of what you need.
Thank you.
Thank you.
Next, we have Peggy King.
Good morning or afternoon. Can you all hear me?
Yes, we can.
Thank you. I agree with Richard Knoll's comments, and I, at the last minute this morning, sent over an email. I did not have a chance to review the urgency ordinance. However, I do support such an ordinance. I think that we really need to do this as soon as possible. And I do agree that this needs to be done by a California licensed hydrologist for these projects. And the reason I would recommend a third-party review of the analysis is because hydrology is very technical. And in reviewing some of the use permit applications for cannabis, there's a lot of information in there, and it may not necessarily be based in fact. And a hydrologist would be able to understand that and know where to look to find the factual information. I think that the initial studies should all have the hydrology water quality box checked. In the one application that I reviewed, that box was not checked. And I believe that High Valley does have very limited water resources, and that box was not checked for a project up there. And so what that means is that it isn't analyzed fully, and it doesn't indicate that there would be a significant impact or how those impacts might be mitigated. And also, as Richard, I think, mentioned, there are cumulative impacts that are important to review as well, so that everybody has their fair share of the water in the basin. So, you know, water supply assessments, water balances are all key components of looking at, you know, a comprehensive water supply and demand approach. And I guess one of the things that comes to my mind in looking down the road is if we start overdrafting these groundwater basins that are low priority right now, or start impacting them, we're going to be triggering a moderate, medium, or a higher priority basin, and then we're going to, you know, get into this whole Sigma issue. So I think that those are things that we need to think about and consider. And I appreciate the board taking this up. I think it's really important and very concerning for everybody here at Lake County. Thank you.
Thank you. Next is Daniel Terrell.
All right, can you hear me?
Yes, we can.
Wonderful. Good afternoon. Thanks for the opportunity to talk. I did not get a chance to look over the urgency ordinance. I have been reading a lot of different articles about what's going on with the water, and we're directly impacted here. Our well has gone dry. And just as a correction. Okay, you gotta wait your turn though, okay? My 3-year-old's here, he's in charge. We got, we're on the waiting list for a new well. It's closer to 8 to 12 months if they even call you back. And that's also a problem too. I'm out in Jerusalem Valley. We're surrounded by about 12 different grows, 3 of which are permitted. I'm very pro-responsible commercial cannabis. I think it's an important part of our economy. 2 of the cannabis projects out here that are permitted, they're going outside of their permits because they don't have the water resources anymore. Does this ordinance cover like continued monitoring, yearly monitoring? How does that get incorporated in, or is it at all?
So this ordinance is specifically about requesting a hydrology report for all projects and a drought management plan. As far as the original ordinance for cannabis, there is annual water consumption reports that need to be submitted over to community development, and it is also you need to provide water from your property. I think also you could get it from an adjacent property with approval from property owners, but there is no trucking of water into those grows. But specifically, since your comments has kind of skirted outside of this agenda item, this is specifically about the urgency ordinance to mandate hydrology reports and a drought management plan added to the list of documentation provided to the Planning Commission for review of the project. Okay, that is all I see here in the Zoom room. Let's open it up to the chamber. Anybody have a comment on this item? All right, let's bring it back to the board. I will say that some of the comments that I heard, I think are very valid comments, but at the same time, I would say that entertaining those comments and changing the ordinance to add these changes to it would only postpone the caution we need to take in approving projects without having the full capacity knowledge of what's going to be impacted by these projects, which is why it's offering to have a little bit more data and a little bit more information. I think it should be part of the conversation as we bring it back for more permanent changes and things like that. There was one comment that I think I do want to add, and that is where it says a hydrology report, and maybe putting hydrology report by a California licensed hydrologist, because I do agree that we don't want to just see something titled hydrology report and submitted to our Planning Commission. We do want it to come from a professional place and not just somebody who manufactured a report on their own. And just wondering what the rest of the board thinks of that.
So I have some comments. You know, I really appreciate the idea behind this. I am concerned after hearing the comments that we don't have enough in this ordinance to make it as strong and effective as we need it to be. And I would just like to ask our county council if she has thoughts on this, because I'm really thinking that we need to work on this one more week and bring it back next week when we've all had a chance to dig into this a little deeper, really look at the comments that were brought up by some subject matter experts, bring in a hydrologist, and really get this as tight as we need it to be. This is a strong ordinance, this is strong for us, and I'm proud that we're having this discussion, but I'm concerned that we're not doing it the best way that we possibly could.
Ms. Grant, do you have a comment on that?
I do think that the comment about the addition of the licensed California hydrologist is important. I think that's a correction that you can make on your face. I think it really depends upon what other concerns that the board has by way of clarification, whether it needs the additional time. Bringing in a hydrologist could easily take longer than next week. I don't know that that's particularly necessary for the urgency ordinance. It would be a big help as you're expanding upon it and developing policy and procedure in that regard. Maybe not immediately necessary for these purposes. If you want to expand this beyond the wells that are being discussed here to include, to expand that further, this would be a good time to consider that as well. But it's really up to your board what concerns you have with regard to this that you'd like to expand upon, and then whether the language for those items will take a little bit of additional time to ensure that all the threads are tied together and you don't answer one thing but then create another question. So it really depends upon your board.
Okay. Any further comments from board members? Supervisor Simon.
So obviously, I am definitely in support of changing it to the California licensed hydrologist to be added to the ordinance. I think, you know, ultimately, we can continue drafting this thing. I think this gives the opportunity for our planning commission to get some more definite information in front of them as they're working through the process. And I do consider this something we should move forward with today. That's how I am feeling about it right now, just being with the situation. And ultimately, yes, you can always make something better. I appreciate, you know, Anita's comments and everyone else's, but I think this puts one more tool in the hands of our planning commissions as we're dealing with these projects as they're coming forward on their agenda. So that's my thoughts on it.
Thank you very much. And I just do want to express, this is meant to provide assistance to our planning commission. They requested our help, and to be very honest, yes, there is other sources of water, but currently the issue that is before the planning commission 95% of the time is cannabis, and the typical water source comes from a well. And so at this point in time, unless there's language that our county council would believe is a better language to use, maybe the project's source of water rather than the project's well, then that would be acceptable. But I don't want to, I personally don't want to wait when we've been requested now for the second time to provide some assistance. We know that these things are going to keep moving along. And right now what's happening, and it's on a case-by-case basis, the Planning Commission is requesting a hydrology report, which postpones these projects even further. Rather than just making it up front, this is what's going to be required of you so that we can really get to a yes and no answer at the Planning Commission rather than postponing things. Because I know some people have waited for quite a long time, some longer than others, but the wait is exacerbated when it goes in front of the Planning Commission and the Planning Commission requests something else. And so I'm trying to provide that assistance to get us there. I think we're all in agreement to adding the California licensed hydrologist, looking around just to seeing if there's nods, and looking at Ms. Grant to see if the project's source of water would be a change, or is that too substantial of a change to make that
Oh, and this is an urgency ordinance. There's no such thing as too substantial a change that you could make on the face of the document today. So you're fine with that. Source of water may be a little bit vague, but it's probably better than limiting it to simply wells, because it would include aquifers and other potential sources of water.
So what I suggest is under Section 1A, hydrology report created by a California licensed hydrologist, and then sub A, approximate amount of water available that the project water source is connected to, or approximate amount of water available for the project's water source, approximate recharge rate of the project's water source, and cumulative impact of water use to surrounding areas due to project. I think that would be a fairly clean suggestion in looking at Ms. Grant.
You might want to add project's identified water source.
Identified water source. So approximate amount of water available in the project's identified water source, approximate recharge rate of the project's identified water source, and cumulative impact of water use to surrounding areas due to the project.
I will tell you that with an urgency ordinance like this, if your board's goal is to get something out quickly as possible and you're tying up certain bases right now, You just have to be aware that both time and other people will give you very good suggestions. You've heard a number of good suggestions today, and you're incorporating some of them just kind of on the fly, which is fine. But application will give you a better understanding of the approach and the definitions for this urgency ordinance. And it's not a one and done. You are fully capable of being able to come back and flesh it out. And as your board's indicated, you want a permanent ordinance that's going to address this. So certainly there's going to be a very comprehensive level of detail, and you may well want to avail yourselves of a hydrology expert to determine how best to craft that permanent ordinance. So
Absolutely.
you're not without options.
Yeah, and I know that some of this is somewhat vague, but at the same time, staff needs the ability to analyze and go through the process of scrutinizing the data that's provided to them, and the Planning Commission needs the ability to have discretion on the information and data that's provided to them. And so right now, I'm just requesting for further data and further information for them to make those types of decisions. Looking to see if there's any comments on the changes that I offered for the identified water source.
Yeah, I have some comments. I'm just still uncomfortable with making these changes and writing this on the fly. And, you know, I know the next planning commission meeting is on the 12th. So I obviously agree with everything that's here, but I just feel like we can take a minute and in a week and make it stronger and better and not do so much rewriting on the fly. I'm not comfortable with that.
Okay, and just for further comment, yes, it is not until, I forget the specific date that you just mentioned, the 12th, but at the same time, it takes time for applicants to update their applications if they are planning to be on the August 12th Planning Commission. So I just want to make sure that it's in due time, and to be honest with you, I think we're about a week or two late in bringing this to the board in the first place. I know I've been playing with the idea for a while, and then after that last meeting from the Planning Commission, I knew that this is a direction that I wanted to take. I have been told that I missed a public comment. If it's okay with the board, I'm going to reopen public comment. Is that okay with the board? Okay, so let's go ahead and open it back up. We have Director DeLeon that also wishes to speak, so let's start with Director DeLeon.
Good afternoon. I just wanted to add, and I certainly am not trying to complicate things, but I would encourage your board to consider a licensed professional civil engineer for the state of California as an additional professional that can submit those reports and not limit it to simply a hydrologist. So that's my only comment.
And can you repeat that title that you're requesting?
Licensed civil engineer.
Okay, I appreciate the comment. Let's go ahead and go to public comment. We have Quincy.
Yes, I'm there. Can you hear me?
Yes.
Yes, I just want to go along with what Scott DeLeon just said. I personally called every listed number in the state of California yesterday trying to find someone that meets this qualification, license in California, a hydrologist, and it's non-existent. I found 4 of them. None of them are available, but there is 10 civil engineers that can produce this report that are available.
Okay. Thank you for your comment. Next is A. Dodd.
Hi, this is Angie Dodd. Thank you. I just wanted to concur with what Mr. DeLeon said and the last speaker. There really isn't a licensed hydrologist in California. There are licensed hydrogeologists, but we found up here in Humboldt County that there are very few of those and difficult to hire. So I agree with putting on that a licensed civil engineer experienced in water resources would be a good addition. Thank you.
Thank you. And then next is Trey Sherrill.
Hello, can you hear me?
Yes.
Yeah, I just kind of wanted to, it's a similar comment. As far as I'm aware, the state of California doesn't license hydrologists. There are certified hydrologists licensed by a national organization. Hydrologists are commonly licensed by the state of California as engineers or geologists. So if you are going to add this requirement, I would recommend making it a state license. I would recommend or request that it would be an engineer or geologist, as those are licensed by the state of California. Thank you.
Okay, I appreciate the comments. And I see nothing further in the Zoom room, and since we opened public comment, opening it back up for the public, if you can please come to the microphone.
Tony Morris. I was wondering if you're going to be excluding people that have like wells that have gone dry from having to go through this whole process again because they're trying to do a new well. It seems a little like it should be grandfathered in rather than have to submit to all of these tests and things again and really jeopardize your personal property or homeowners. I think homeowners should be in a different category than trying to stop cannabis growers and things like that. So.
I apologize for the confusion. We're talking specifically about applications that would go to the Planning Commission, and a well permit would not go to the Planning Commission.
Oh, so they would only have to do the one thing?
It would, if you're getting a well permit, you would go through environmental health. If you're trying to do a project, a major land use project, such as a cannabis operation, you would go before the Planning Commission. This would require applicants going in front of the Planning Commission to provide these types of documents.
Okay, just checking.
Yeah.
Thanks.
Any further comment in the public? Okay, let's go ahead and bring it back. I have a question for Ms. Grant. Would it be possible to table this and request that you come up with a catch-all phrase for a professional, that way we don't have a specific title, and that way we, again, leave it up to our Planning Commission to hear and receive the report, and if it's done by a geologist, good. If it's done by a hydrogeologist, good. If it's done by some random guy, then not good. But it would be nice if we can have something that catches the profession itself rather than speaking of a specific title. And not sure if that's possible or not, and I apologize to put you on the spot like that. Can you please comment?
Well, I think you can say a hydrology report prepared by a licensed civil engineer, geologist, or hydrogeologist experienced in water resources. I think that was one of the suggestions, and that should encompass all of the suggestions that you've heard. You can also say licensed hydrologist, but if there aren't any, it's going to be hard, but you can include that. So prepared by a licensed, California licensed civil engineer, hydrologist, geohydrologist, or geologist with experience in water resources.
Okay. I'm comfortable with moving forward just because I think it's important that we move forward with that. I appreciate all the comments in order to lead us in the right direction where we don't just have a random report just submitted for the sake of submitting a random report. Ms. Grant.
I would also remind you, because this is an urgency ordinance, it is a 4 vote.
Yes. Any further comments from the board on those changes or anything else related to this item? So,
I'm going to make another comment. I'm not going to hold this up today, but I think this process is sloppy. And I would really, if we're going to be bringing urgency ordinances, I would like county council to be involved in the drafting and be able to have adequate time to review it. And I'll just leave it at that. I think this is important. I'm going to vote to move forward with it, but I think we can do better.
okay. Supervisor Crandall, I'm going to ask you to take the gavel, please.
Yes, so,
The metaphorical gavel.
metaphor. All right, so I will go ahead and ask if there's any action that needs to be taken.
Yes, I will make a motion to,
I think it's offering.
oh, I offer the ordinance with the amendments.
The ordinance has been offered. Johanna, can you conduct the
Yeah.
roll call?
Okay, so Supervisor Simon,
Yes.
I'm trying to, okay, Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Yes,
Thank you.
and I will pass the gavel back to you.
Thank you very much. It is 12:50 p.m. at this moment in time. Our next item, I think, will require quite the conversation. I'm looking at the board. Do we want to take this item up now, or do we want to take a lunch and come back? What is your preference?
I think we need lunch.
Yeah,
Okay.
I agree with that.
So let's come back, since we do have many items left over, if we can come back at 1:30? Does that work with everyone? Okay, let's come back at 1:30 p.m.